ambulance emergency. What town was that?
He's trying to kill himself.
Okay, so tell me exactly what's happened.
He's tried to strangle himself. I think he might have succeeded.
Is he hanging right now?
I'm taking him down.
Okay.
So his eyes are open. He's
I've organised help for you, okay? Stay on the line. Is he awake right now?
No.
Is he conscious?
No.
Okay. Now, I'm going to tell you how to give mouth to mouth.
Okay.
Place your hand on his forehead, your other hand under his neck. Now pinch his nose closed and completely cover his mouth with your mouth. Then blow 2 regular breaths into the lungs, about 1 second each. The chest should rise with each breath. Do you feel the air going in and out? Okay, listen carefully. I'll tell you how to do resuscitation, all right? Place the heel of your hand on the breastbone in the center of the chest, right between the nipples. Put your other hand on top of that. Pump the chest hard and fast 30 times, at least twice per second, and 5 centimeters deep, at a rate of 1, 2, 3, 4. Are you pumping the chest? 1, 2, 3, 4. 1, 2, 3, 4. Give him 2 more breaths, okay?
Yeah, coming in and out this time.
Oh, good. Okay, so from now on, you give him 2 breaths and then 30 pumps, 2 breaths and 30 pumps, okay? This will give him the best chance until the paramedics get there, okay? 2 more breaths. Okay, 1, 2, 3, 4. 1, 2, 3, 4. 1. Keep pumping the chest, mate. Keep pumping the chest until they take over from you, okay? Is that the paramedic there?
Yeah, well, I'm saying. Confirm code 2.
Okay, thanks, mate. Confirm code 2. First hanging.
You good?
Yeah.
That's the 3rd one today. So bad.
And there were 4 yesterday. That's 7 in a day and a half that we know of.
It's really bad.
With a code 2 cardiac arrest confirmed,
Can I just take 5?
Yeah.
Yeah.
Chris will have an anxious wait to know whether his CPR guidance has been effective. In Liverpool, paramedics Joe and Saha are starting their shift in ambulance 833.
I've got an ongoing joke with my mum that I'm never going to have a baby.
Oh, why?
Because she's always asking me for grandchildren. So I'm always like, nah, not today, Mum. Nah, I'm not going to have a baby. You're going to have to just deal with it and be a puppy grandparent.
Oh, don't do that to her.
Yeah, she hates
My fellow paramedics are just as important to me as my family. You're spending more time with them than you are your family sometimes, because for 9 weeks you're with them at least 12 hours a day and they just learn everything about you and you can't escape.
Ambulance, what's the town nurse number of the ambulance? You with the patient at the moment?
Yes.
Is he awake?
No.
Is he breathing?
No. His heart is just going and out still.
3 paramedic teams are immediately dispatched to the drug overdose. Car 834 is almost on the scene. In 833, Joe is the closest intensive care paramedic. He and Saha are still 8 minutes away.
Male who's unconscious, clear left and not breathing.
Unconscious and not breathing.
He's overdosed.
Yeah. So if he's actually not breathing, though, we can assume that it's a hypoxic arrest, yeah?
Yeah.
This is very serious.
It's on its way, okay. Do you know what he took? Do you know what he took? Are you there?
Joe and Saha are one of 3 paramedic teams responding lights and sirens to a drug overdose.
Thank you, and have you found the patient? Yeah, affirmative, and confirming code 2.
Oh, right,
Can we have medic for R1 and the 2?
Right, this is a really young cardiac arrest.
34, thanks.
Are 8:33 ETA in less than 2 minutes.
Code 2, or cardiac arrest, means the patient's heart has stopped beating. With each passing minute, the chances of surviving reduce by 10%. It's unknown how long the patient has been lifeless as the caller has hung up.
So is this it?
There, but I can...
133. As an intensive care paramedic, when I arrive in a cardiac arrest scenario, I'm privileged to often have a team to work with. The team's goal is to get a ROSC for this person, return of spontaneous circulation. Another one, another oxygen. I'll grab that. To get a heartbeat back and to try to maintain that all the way to the hospital.
Hi guys, how long have you been doing CPR for?
1 minute. So I've got 1 minute to the next check. Been on the floor for about 5 to 10. His mate said he may have had some heroin.
Yep.
Continue compressions, oxygen's away, all else clear. Charging, confirm 200 joules.
200 joules.
Stop compressions, analysing. I have asystole confirmed.
Thanks for using the black wheel for us, mate. Sarah, can you jump on, please? Can we put a metronome on, please?
Yep.
And try to stick to that.
Next coach.
Asystole is the most serious form of cardiac arrest
Yep.
when there's no electrical activity in the heart.
So you said definitely heroin. How did you figure?
The other guys just removed the syringe and threw it down the drain.
Where was that other guy?
The other 2 guys ran off. They're his
They've run
mates,
off.
apparently.
Continue compressions, oxygen's away, all else clear. Charging, confirm 200 joules.
That's 200 joules.
Okay, all clear.
Asystolic, yeah. Just cancel charge using the wheel.
Yep.
Cancel it for us, guys. Thank you. On the chest
Sorry.
for us. Thank you.
Next coach is...
When somebody's heart stopped, they're not getting blood to their brain. And the brain damage from not getting oxygen gets worse and worse and worse and worse. So it's not even every minute matters in these circumstances. It's every second.
what time are we going? 14 on
14.
We agreed that if we get to 20 minutes and he's still asystole despite access, go for it.
Yes.
Everyone happy with that?
Yeah.
Yeah, so we've got another 7 minutes. Yeah.
How are we looking for access, team?
Yeah, we just found a vein.
All right.
Sharps out.
Guys, can you, one of you, just have a look in his pockets, be really careful, needle-wise, yeah, because it's query heroin overdose. See if you can get some ID and find out anything about this gentleman for us. Tough.
We've got IV access to the right one.
IV, excellent. Let's draw up some adrenaline.
Okay, that's running nice and...
All right.
This coach, if it's non-shockable, do signs of life.
Yeah.
So, chest compressions continue, all else clear, oxygen's charging. Okay, hands off.
Stop.
Everyone clear. Say systole, dumping charge.
Yeah, okay. Have a listen, Signs for Life. Have a listen for, heart sounds. Got anything for pupils, Joshy? Fixed dilated
No
pupils,
signs of life.
yeah. That's it. Okay, yep, no worries. Can you let them know, Brennan? Thank you. Let's disconnect our gear, we'll start to pack up. We've got a blanket already. It's certainly not possible to save everybody's life. Do we ever get used to it? No. We cope because our colleagues are amazing and they give you the support that you need through it. You have to remember that someone's son, daughter, that's a loved one to them. So we never get used to it. And the day that we get used to it is the day that we should take the uniform off. That was really horrible, actually, because we know that to survive a cardiac arrest, it's early CPR, early defibrillation. Otherwise, generally, they're unsurvivable, right?
Yeah.
His friends, they're just trying to cover it up, right?
Yeah, but it's not helping.
No, it's not. Do some CPR, mate. Help your mate. He just left him. They left him dead.
Yeah.
On the side of the road.
Yeah.
This makes me a little bit angry, actually, because he's really young.
Yeah.
Our call takers are amazing. They give the most detailed instructions and they are simple to follow. Listen to our call takers and you won't go wrong.
Oh.
40 minutes ago, Chris helped a caller perform CPR on a patient who'd attempted to hang himself.
So he's critically ill. Nothing about being deceased yet, but they're at the hospital. Yeah, I'm gonna go have a chat with Nicola, see what she said. Interesting.
I just heard a little bit of the code 3, so he'd been gone for 30 minutes, and when they got there was CPR happening on scene, and they managed to get a ROSC, and he had a heart rate. Yeah, so they transported him. So fingers crossed he's all right. So
thanks for that.
That's good. Yeah.
The update.
Yeah, no worries. 5:45. Thanks, guys.
He was dead, came back, now he's at hospital. Yeah. Go him. It's insane. I don't know how to feel about that. that doesn't happen often at all. I'm shocked. I'm honestly shocked. Every minute lost of non-effective CPR pretty much reduces their chance of life by 10%. But yeah, we're doing CPR on the guy and said, I just had back from the dispatcher that the patient was dead. Then they got a ROSC, so they managed to get him back. To get information like that, it's just like, oh, adds a bit of happiness to my day knowing I'm assisted in somewhat way, so which is good. It's all part of the job, and that's one of the perks of the job, hearing things like that. So, good job to the crew, really. Oh, yeah.
Good job. That's a win.
You deserve a medal today. You saved a life.
Just another call.
Just another day on the job. No, that's awesome, though.
Good, eh?
Have you tried to have some water?
Excuse me, we're just going to come in here. Thank you.
It's 1:30 p.m. and the City to Surf is drawing to a close. Today, crews have attended to more than 300 participants requiring medical attention, many occurring after they've crossed the finish line.
Ambulance emergency, the town or suburb, please.
I'm on platform 3 with town hall incident. There's a woman, she's just been in the City to Surf and I'd say she's in her 70s or 60s.
Okay.
She doesn't look well.
Okay, I'll just get some questions answered and we'll get you some help.
Spec 65, Sydney.
Hey, 1C at Town Hall Railway Station.
70-year-old female who's fainted.
Duty Operations Manager Giles is immediately dispatched to the woman who's fainted underground at one of Sydney's busiest train stations. He's only a few minutes away.
With a large-scale event, there's always extra compounding factors, from being able to access the patient, being able to get to them through a crowd. But as it starts to wind down, participants start to spread out from where they were as they jump on a train or bus or taxi and end up home.
Excuse me.
And they're still going to be suffering from having done an exertion which is unnatural for them.
Sorry, what's your name, ma'am?
Janet.
Janet. I'm Giles. How'd you go in the run?
I got to the end. I think it might have been the bus.
Okay. So when you were feeling faint, did you have any chest pain or breathing problems? Just lightheaded and dizzy?
I was okay in the train.
Okay.
Now, so when I began to walk, it was very sore.
Well, it might be your blood pressure as well. That's often the case. Do you know what your blood pressure is normally?
15 or 20 over 80.
It's about 90 on 60 now, which is probably why you're feeling faint. So what we'll do, I'll pop a needle in, give you a bit of fluids, that'll bring your blood pressure up, and it might run you up, get that looked at hospital.
I'm just going to give you some morphine for that pain. Now, it may make you feel a little bit sick.
G'day, Nolsey, it's Giles. I think we're going to need probably a Stokes to get her out. If you've got a soddy round or police rescue.
Is the pain getting worse, Janet? Okay.
You move it where you want it. I'll just give you a bit of support.
Okay. Deep breaths.
The exact source of Janet's pain is still unknown. However, it's so severe, she's unable to move.
Now, Janet, I'm going to give you another bit of medication that's going to make you feel lightheaded and floaty. Sometimes people feel it's a bit weird because it spaces them out a bit too much. and they feel a little too out there, ketamine. Yeah, it's an anaesthetic drug. Just think of a nice, happy place and try and relax and go with it, and you're perfectly safe. Some people feel like they're falling. We've got other medications that can undo it if you're getting too freaked out. It might make the world spin and you're on a lovely trip. So think of a lovely, quiet, relaxing place, being on a beach somewhere if you like, or a nice pina colada. Nice, slow breaths.
With ketamine, you get this disassociation from your body, a nightmare sensation. To prevent these nightmare scenarios, it's a combination of understanding the patient, building up that rapport, and reassuring them that it's all okay.
Might be my last sitting, sir.
Yeah, wow.
I have done 31.
Wow.
86 my first one. The first ones I ran downhill. My latest years I have just...
It's almost like truth serum. People start saying things they probably shouldn't have. Sometimes people get quite flirty with the nurses, even from old nanas putting a hand on a knee. Oh, you're awful cute.
Janet, we're just going to roll you away from the sore side. 1, 2, 3. Up on the board. Wonderful. Rolling. How you going? We got you off that uncomfortable seat.
I think after a job where you've actually been able to make a difference to the patient, there's a sense of pride and accomplishment.
How you feeling?
It's very strange.
Oh, good, but not painful.
I don't know what happened.
That's all right, just relax. Couple of big breaths, Janet.
There's also that personal feeling that you've actually helped someone. You've helped Nana up, you've allowed her to keep going with the rest of her life or the rest of her day, and you got her back onto her feet.
You're very good.
Excellent.
It's certainly lovely when you do get some appreciation or recognition, or someone writes a letter in. It's fabulous. But we're not doing it for recognition. We're doing it for the patient.
How did you do that? Is it just a balloon or is it?
Balloons, yes.
And then you filled it with Play-Doh?
I did.
Did it make your day less stressful?
No.
Ambulance emergency, tell me exactly what's happened.
I broke up a dog fight and my hand's a little worse for wear.
Has it been bitten?
Yes.
I've been having hiccups for almost 1, 2, 3 hours now. Ambulance emergency. Tell me exactly what's happened.
My friend, she tripped over on her skateboard and her foot looks like it's broken. Her ankle's like really badly bleeding.
When did this happen?
Like 5 minutes ago.
Okay.
She fell off her scooter and hit the gutter.
Oh, she fell off the scooter or fell off the skateboard?
Skateboard, yeah.
And you're out on the street now, are you?
Yeah.
And what's your nearest cross street there?
I don't know.
Are you on the street?
No.
Where are you? I thought you said you're on the street and your friend hurt herself.
Yeah, I saw my friend Ian, she's on the grass now. My friend's screaming.
Okay, now with that bleeding, we're going to try and stop that bleeding, alright? Just get a clean, dry cloth or towel and place it right on the wound itself, okay? Can you go inside to your house and get one out?
She's not awake.
She's not awake?
No.
So she's unconscious?
No, she's not. She's breathing, but she's not awake.
Say the word now every time she takes a breath in.
Now.
Next breath.
Now.
Next breath. Is she taking a breath?
No, not yet.
2 ambulances are dispatched to the 14-year-old patient who has stopped breathing. The nearest crew is 10 minutes away. They are travelling lights and sirens.
All right, love, so what I'm going to do is I'm going to tell you how to do mouth-to-mouth, all right?
Okay.
So I want you to pinch her nose closed and completely cover her mouth with your mouth.
Okay.
Then blow 2 regular breaths into lungs, all right? about 1 second each. The chest should rise with each breath. What was that noise?
I was breathing into her mouth.
Are you laughing? Because we've got ambulances coming to you very quickly to try and help this person.
So I want you to pinch her nose closed and completely cover her mouth with your mouth.
Okay.
Then blow 2 regular breaths into the lungs, all right? About 1 second each. The chest should rise with each breath. What was that noise?
I was breathing into her mouth.
Are you laughing?
No.
Because we've got ambulances coming to you very quickly to try and help this person, so we need you to concentrate on what we're saying and not laugh when we give you instructions. Do you understand?
I'm sorry, no, I'm telling the truth, she actually is really hurt.
Team leader Chantel and call taker Chris have spent 13 minutes assisting a young girl perform CPR on her friend who's fallen from her skateboard. While there's suspicion of a hoax, the team must treat all 000 calls seriously. 2 paramedic teams have been dispatched.
How old are you?
I'm 15, I told you that. If you don't believe me, I might as well just hang up and then
No, we've got ambulances on their way.
My friend's not even breathing. And
So what you need to do is follow our instructions, okay? Step. You need to follow the instructions step by step, okay?
And I'm still with you, okay? This is really important, all right? If you say your friend's not breathing, we need to try and help her, okay?
Hey.
All right, so now I'm going to tell you how to do resuscitation, okay? Just listen carefully. Now place the heel of your hand on the breastbone in the centre of her chest, right between the nipples, and put your other hand on top of that, all right? So what we're going to do is we're going to do it at a rate of 1, 2, 3, 4.
1, 2, 3, 4.
1, 2, 3, 4. 1, 2, 3, 4. What was that noise?
She's breathing again.
She's breathing again, is she?
Yeah.
Okay, can you see any paramedics there at all?
No.
Okay. Okay, well, you're at the address you gave us. Can you see them?
Yeah.
Now, can you see 2 guys, 2 men?
Yeah.
Okay. Because I can see that the paramedics there, looks like it could be 2 females. Waste. It's a waste of resources.
It was a hoax. Let's ring those mobiles back.
Bloody hell. That's so awful. That's 4 paramedics, 2 crews for what, a job that doesn't exist?
Do we know where they are?
There's no one at the address.
Yep.
That's really upsetting.
Very.
You can imagine some poor 15-year-old doing CPR on their 14-year-old friend.
To find out it's a load of crap.
Over the last year, 15% of ambulances dispatched in New South Wales were considered to be a waste of resources. That's approximately 450 incidents a day.
I know the crew's there and can't find anyone, so we're crewing a hoax. She got a bit stroppy when I got on the phone, so, you know, if you don't believe us, we're going to hang up, that sort of stuff.
Paramedics are swiftly called down.
That's just frustrating. It's not on.
How does a 15-year-old think that pretending someone's dead is fun?
Bloody dumb.
Copy that, no worries.
34 on channel.
As daylight fades, Duty Operations Manager Brian starts his shift. On weekend evenings, the average number of motor vehicle accidents increases by more than 40%.
35 understood. I'll make a note of that.
Inspector 34, Sydney.
1 CMBA for you.
Thanks, I expect 34. Dropping it down now.
Copy, thank you.
Reports have come in of a car crash in Sydney's southwest. Police have been notified, and Brian is the closest available paramedic, only moments away.
You can see the car now, he's just approaching.
The driver has abandoned the vehicle and fled the scene. Brian must now track them down in order to assess any potential injuries.
Just need to find out where they are.
I'll check it up.
Yeah, thanks. We'll continue northbound. Give you a report. Unfortunately, as paramedics, we go to car accidents, which a lot of the time, it's avoidable. By people just actually not getting high on drugs or alcohol and deciding to get behind the wheel of a vehicle. Yeah, copy that if you wouldn't mind, thanks. Police have just arrived on location as well.
The driver is located 1 kilometre from the crash site.
Yeah, copy that, thank you. What's your name, mate? Yeah, no. Matty, I'm here to help you. I'm from the ambulance, okay?
Who told you not to say anything?
Who told you not to say anything?
You never hurt me. I told you.
Who was that?
I can't say anything.
The driver's friend has also arrived on site.
What are you doing?
So what's happened, mate?
My name's I got a call from his mum saying that he's had 2 bottles of wine.
Right. Mate, sit up, buddy. Come on. Hop off the road. Sit against there, bud. Sit down here. We just sit down.
No, sit down. Sit down.
No, sit down, please.
Just sit down, okay?
Just do what the police asked you to do, mate, okay?
Sit down, mate. Just sit down. Sit down. Do the right thing and sit down before you get hurt any further.
So he drove the car from the house, did he? Okay. He'll go down for blood and alcohol. Buddy, don't do... Just calm down, mate.
Stop. What are you doing? What are you doing? If you don't calm down, you'll be cuffed and be thrown in the back of the van, okay?
Has he ever had a mental health assessment?
He is the high-vis.
All right. We'll take him down to hospital.
That's my town.
Yeah. So he's obviously been driving a vehicle, which obviously is another level of complexity for the police. So, all right. I've got an ambulance on the way, so. The devastation that drug causes. It changes people from being normal members of the community to just uncontrollable beasts. I've had situations that have turned from being calm to violent within seconds. As a duty operations manager, the first and foremost priority of managing every scene is the safety of both myself and my colleagues. Unfortunately, paramedics have been punching bags for a number of people over the years, and it's escalating. Are we taking it, or are you going to take it?
I'm just leaving there for the time being.
Yeah, that's fine.
And he runs off.
Yeah, no, I agree. We're chasing. A person who's affected by ice is just so unpredictable. You never know what's around the corner. You never know what you're going to be exposed to. And you never know where you're going to end up going home to your family. Are you here?
Yeah, kick me in the face.
Oh, right.
Mate, stop kicking the door. We're going to move you down to the paramedics now.
Duty Operations Manager Brian has discovered a young man who's crashed his vehicle under the influence of alcohol. Of greatest concern, the driver also has a history of using the drug ice.
You just see the melee down there? Yeah. Okay, so this is him. He has consumed 2 bottles of wine. He has previously taken medication overdose. He's just kicked the police officer in the face. He's full as a boot. The unpredictable behaviour of patients who are ice affected, the level of aggression is just extreme. All right, so you got all the restraints ready? Hey!
Wait. Stop kicking!
In some cases, the decision may be that that person's so violent, it's actually risky for paramedics to transport. Yeah. We'll hold him down and then, we'll get the restraints on him.
All right, there you come. All right, so, it's okay. We're not going to hurt you. But you've got to be...
Come on, mate. The ambos are just here, okay? Come down here. Come down here, bud. Just sit down here for us. Hang on, mate. Just give me a sec. It's all right. We're just here to help you, buddy. Have you taken any medication tonight, mate? We just need to know.
Tell me that everything will be okay. They told me that everything will be okay. They told me that everything will be fine. They told me nothing is gonna hurt.
Hey, keep your legs straight. Keep your legs straight, buddy. We're here to help you, mate. You just got to calm down. All right, let's get this one in.
We're here to... Listen.
Hey, we're here to help you. Sit back. Sit back. We're here to help you. We're trying to help you. All right? Well, listen. Yeah, okay, listen.
Please stop. Please stop. This is the master election. Stop. Please.
I'm finding it more and more that commonly that we actually are needing to sedate people to get them to hospital to provide care. Okay, you guys right?
3, 1, 2, 3.
We're torn between a duty of care to the patient and then making sure you can go home at the end of your shift. And unfortunately, my family come first, every time. Make sure it's nice and tight. Sadly, in 28 years as a paramedic, what I've found is the ice issue in the community is increasing. We've got younger and younger people who actually now are taking drugs. Every parent that's lost a child through taking an illicit substance would never have predicted their child would have done that. As a parent, how do you deal with that? I think, wow, you know, like I'm going to educate my kids about drugs and, you know, touch wood that I'll never be in that circumstance. Yeah, and I really hope that with the right guidance, they'll grow up, you know, to be equal contributing members of society and most importantly, enjoy life.
Oh, we're turning on to McDonald Road. You know that's a sign.
In Liverpool, paramedics Joe and Saha are waiting to be dispatched to their next call-out.
We're not having McDonald's.
You're not having McDonald's.
No. I thought you wanted Hungry Jack's hot chocolate.
I do want Hungry Jack's hot chocolate. But I'm probably going to want to eat again.
Look at that, Hungry Jack's on McDonald's Road.
It's a sign.
Ambulance emergency. Tell me exactly what's happened. My son's just fallen off play equipment and he's bleeding a lot. And how old is he? 3. Tell me exactly what's happened. The girl actually got stuck on the bed frame. She's stuck? Yes, she's stuck. Tell me exactly what's happened.
I have a 19-month-old boy and he's having gastro. He's refusing to drink. We're trying to give him Hydrolat. He's just vomiting everything up.
Is he breathing?
Yep, when he's vomiting, he's struggling though.
8:33.
Yeah, 33, we can assist.
1 Charlie breathing problem. In Denham Court. Per the column notes, it's gastro.
33, no worries at all.
Okay, is he changing colour?
His hands and lips are slightly bluish.
Okay, I'm organising help for you now. Stay on the line, tell exactly what to do next. Just watch him very closely.
Yeah.
Turn the outside lights on for us. Okay, if he does get worse, there's any way to call back immediately for further instructions.
Embos drop out of the sky for a child who's not breathing. They just all of a sudden become available and there's multitudes of them.
It doesn't matter what you're doing. Even if you've got a patient in the back, you jump
Yeah,
it.
you jump it. Absolutely you do. A high priority lights and sirens job that involved an infant always brings me back to my own family because I've got 2 beautiful little boys they're just so precious, you know, like...
It's more disheartening when the child can't tell you what's wrong. They just know that they're unwell and they just look at you with such sad eyes.
Yeah. Little bubs. Being a father, you physically feel your heart rate escalate. You physically feel that your palms start to sweat up slightly. And your focus is so much more in tune. He's going to be sick, I think, this child. He's going to be very sick.
Father of two, Joe, and colleague Saha have been dispatched to a vomiting toddler who's also experiencing difficulty breathing.
I've had to respond to Jordan once.
Okay.
And that was a really scary experience. Really, really scary experience.
What was going on?
My wife called and he had this horrible breathing. She goes, look, I know he gets croup every now and again, but this sounds really bad.
Did he respond well with you treating him?
Yeah, it was quite severe initially, but he responded really well to the treatment. Children are the pride of their mum and dad, and they're their everything. They are their world. So for us, you know, we're handling the most precious cargo to that person. You push that available button, you just do not know what you're going to go to. It could be the most terrifying thing you've ever been to, or it could be the sweetest thing you've ever been to. Hello. You're all right, you're all right. Hello, how you going? Hi. Where are we going?
Straight into the living room.
Yep.
Yeah, come in.
No worries.
Hi.
Hello.
Come on.
This little bub?
No, this one of my hands.
Oh, hello. How you going? What's his name?
Ananias.
Ananias.
He was
What's
pretty
happening with him?
On Wednesday, he started to have diarrhea and vomiting, so my husband took him to Western Hospital.
Yeah, Western Kids?
Yes,
Yeah.
and they said it was gastro.
Yeah. Is the diarrhea still going?
He only had it once this morning, but the vomiting hasn't stopped. So
Okay.
he vomited twice.
Yeah.
And he vomited again now.
Okay.
And when I gave him a shower, I noticed that his hands kind of went bluish. And I called my husband, I said, is it me or is his hands going a bit blue?
Yeah.
And then when she got him out of the shower, he just started throwing up.
Yeah.
And it just started coming.
Kept going,
and coming,
kept
and
going.
coming. His lips went blue, his
Yeah.
hands went blue, and he started shaking a little bit.
Yeah.
Wow.
Come over here. Hello.
Maybe because you're closer to the TV.
Maybe he just wants a TV. Oh, these. Do you want these? Right.
At Westmead Hospital,
Yeah.
children's, they said to me, if he gets worse, if he's not drinking any fluids,
To call us.
to call,
Absolutely.
take him to hospital.
Yeah, yeah.
If he vomits, just ambulance straight away.
Can I have this back for just a tick? I'll give it back to you, yeah? I'm just gonna have a listen. Is that all right? You ready?
He'll let you listen.
The little ones are gorgeous. They love paramedics. They see the uniform and they will give us high fives and they'll wave at us in the street and they'll give us cuddles. And for us, that's a beautiful part of our job. It really is. Okay. I'm sorry, buddy. This is gonna hurt.
Do this.
Oh, what happened?
Delayed reaction.
I hate the delayed ones. To get trust from a little child that has no idea who you are except for the fact that you're a paramedic is amazing. It's super cute.
We never have patients that want to cuddle us.
No, and look how quiet you are all of a sudden. Like I said, you guys are doing all of the right things.
Yeah.
Yeah, keep his fluids up. As long as he's taking them, happy days, that's good. If he doesn't, then yes, he's gonna need a drip.
What do you want?
What's this? What do you want? What's this?
Wants you, Joe.
Come, you can come.
I think we're going to have to take
Should
you
we
with
take you
us.
up? Should we take you in the ambulance? It's your decision, Mum, Dad. Like, if he will tolerate, excellent. If you won't tolerate, let's go up and get him a drip. Okay.
And knowing he's going to get a drip, I'll be
Yeah, no worries at all.
And sitting here trying to force him to drink.
Good. Let's go. Sometimes a parent runs out of options. Like, my child's really sick and I just don't know what to do anymore, and they pick up the phone and call 000. And that's probably really, really scary.
Alternatively, if you wanted to pop them in the car and go to Westmead, we're happy with that, whatever you guys want.
Sometimes all they need is you know what, Mum and Dad, you have done all the right stuff, and that's amazing.
Hey, Sarah, can you pop the beacons on for us? Oh, wow. Look at that. Aren't they cool?
It's absolutely gorgeous when a child makes that connection with me or any of the paramedics that are there. It's heartwarming. It really is heartwarming. And you get that real human intimacy that you wouldn't get from any other job.
You got to say bye to your number one fan, Joe.
All right. Bye, buddy. Oh, no, done. Wiggles are on. It's over.
Did you hear the couple in the Wiggles? They split up. Oh, it's so devastating.
How do you keep up with this stuff? All the best. Good luck with it all.
Bye-bye.
See ya.
Have a great night.
You too.
Much appreciated. Not a problem.
It's our pleasure.
Anytime.
Take care. Bye.
To engage with people's families and see how much love and see how much care when you walk into a house, it's a nice thing. When we see so much bad in our job, to see that nice side of humanity is beautiful.
He was cute.
He was adorable.
He loved you.
He was
straight
absolutely
away.
adorable.
He was like, okay, we're going to be friends.
And he's going to be just fine. He just needs to be rehydrated, all right? And he'll be just fine.
I think you made a new friend tonight, Joe.
It's made my night.
And his little brother, oh, I got so clucky.
Oh, you got clucky? That's good.
No, it's not.
Ambulance emergency, what town or suburb?
They're on the way. And my partner's having a baby. Okay, I'm going to organise an ambulance for you. I need you to stay in the one spot, so pull over into a safe place and then give me the address. She's out, the baby's out. Is the baby breathing and crying? She's crying. Yes, we're going to get it to you as quickly as possible, okay?
Without pulling the cord tight, put the baby in the mother's arms or on her belly and be sure the cord is not wrapped around the baby's neck. Okay, I'm staying on the phone with you until they get there, okay? Did you have a boy or a girl?
It's a little girl.
Oh, fantastic. Congratulations. That's a good sign. Congratulations again. That's a little bit exciting to be involved in the birth of your baby.
How far away is the ambulance?
We're working on that. 5 minutes away. 5 minutes away. Every minute feels like forever when you're in these sorts of situations, but the best thing we can do at the moment is to keep a close watch of mum and baby.
Yeah, they're pulling up behind us now.
Are they right with you now?
Yeah, they're with us now.
Okay, I'll leave you with the paramedics. You did such a great job. Bye-bye.
Thank you.
I wasn't expecting that.
Isn't that funny? I spent 12 years out there, never delivered one. I got here my first week I had a baby.
Every single time you just always get goosebumps.
It is my first baby. Yes, very exciting.
You did good. You did really good. Really well. I'm impressed.
In the eastern suburbs, new graduate Laura is getting ready for her first day on the road as a trainee paramedic.
People keep asking me, you know, if I'm excited for my first shift as a paramedic. I don't even know what the emotion is, what the right thing to say is. I'm just thinking, is this happening? Like, is this actually happening?
Her mentor today is experienced paramedic Blake.
First day on road.
First day on road.
You'll be right, don't worry about it. It'll all be good. You familiar with the car?
Ish, yeah.
This is the phone that we use to phone the cardiac unit. Should we
Laura spent the last 2.5 years working as a call taker.
You really can only go so far as a call taker. Not getting to find out what's happened with the patient, that's one of the really difficult aspects of the role. You don't get that closure. I love it, but it's time to take the next step.
We come to the back of the car. These are all our kits, okay? They're labelled.
The thing that I'm most worried about, it's the unknown. It's not knowing what's going to come and being able to deal with things as they happen. I am feeling petrified.
Ambulance emergency, what town or suburb, please?
In the bush, on the other side of the creek in the swamplands between the I'm not sure if she had a full packet last night or half a packet.
Of what, sir? Of heroin, okay. Ambulance emergency, well, tell me exactly what's happened.
A bloke was just going for a run. He smacked into me against like a bench, and his whole knee split open. Like we can see the bones and everything.
Ambulance emergency, what suburb are we coming to?
Hello, it's at Sydney Airport at the domestic terminal.
Okay, so tell me exactly what's happened.
It's a 63-year-old male. They're experiencing chest pain.
Okay.
We're going to go to chest pain at the airport. Pick that up. Go 423 on the 1C.
423 on the 1C at the airport.
Laura and Blake are the closest crew, only 10 minutes away. Chest pain is one of the most urgent call-outs a paramedic can get. A significant number of life-threatening conditions can cause chest pain. A fast response and diagnosis could save the patient's life.
When you're driving, especially licensed drivers, that door is your responsibility.
Okay.
You're going to say clear left or no.
Okay.
Strong and loud, do you know what I mean?
Yep.
I use this analogy with driving. You're the sheepdog and they're the sheep and you've got to push them where you're going.
Yep.
You know? So clear left.
Yep, clear left.
And we'll head out the airport.
My first job being lights and siren to a chest pain, it's very scary.
It could be anything from cardiac-related chest pain. It could have a pulmonary embolism.
Obviously, within my scope, I'm only allowed to give aspirin. What else do you do for a chest pain?
GTN.
Doing a 12-load GTN.
So I'm imagining the person on the other end of the phone and being asked all of those protocol questions, which I've asked 5,000 times before.
Is she completely alert?
I'm unsure.
Okay.
And all of a sudden, I'm going to a job that I've spoken to people on the phone about, but this is completely different.
Yeah, we are.
We're going to need the life pack,
Yep.
the fibre,
Yep.
and the green kit.
Okay. Chest pain, it absolutely could be a life and death situation. He could go into cardiac arrest. It's petrifying. But something that is so important in this job is having good communication skills. And as a call taker, that's something that I feel like I'm very, very good at. Hello. Do you know his name? His name? No? Okay, that's okay. Hi. My name's Laura. On a scale of 1 to 10, if 10 is the worst pain you've ever had, what number?
The patient can't speak or understand English.
Okay. It's a very scary thing, no English, and you're trying to work out what's going on with people. In this job, a mistake could be life or death. On a scale of 1 to 10, if 10 is the worst pain you've ever had, what number?
It's Laura's very first call-out as a trainee paramedic.
Okay.
The patient has chest pain and can't speak or understand English.
What language are we speaking? Mandarin?
To go from call taking to a very new level 1 paramedic, it's super, super overwhelming. you've got that big responsibility of treating their pain. And the stakes are so much higher in this job.
Okay.
With no interpreter available, Laura decides to try a translation app.
Yes, I do.
Yeah.
Okay.
Speaking.
When did the pain start?
This morning. Yeah.
Okay.
6.
Yep. Okay. All right. How bad is the pain now?
Let's go a different way.
Yeah, we're not getting
Yeah,
anywhere.
no, it's fine. Let me just jump in here.
All right.
So,
I'm just going to take his blood pressure. Okay. Has he ever had aspirin before?
Every day about 100.
100 milligrams. Blake, I'm going to give him 300 milligrams of aspirin. You happy with that? There are no dumb questions. Because you're having the chest pain, I'm going to give you 300 milligrams. With anything clinical, you can't get tied up in, should I, shouldn't I ask this? So put it in your mouth. Because if you don't, that could be the difference between someone getting better or making someone really sick. Good job. Can you sit forward for me? Sit forward for me.
Are you flying in or are they?
They're flying to Melbourne just for holiday.
Okay, that's all right. I'm just
But
trying
they already missed about 2 flights.
to. I'll do the 12 while you set up the 4.
Sure.
Just stay still. Just relax.
Time is critical, so they use an ECG to see if there's something wrong with his heart.
Sinus rhythm, possible right ventricular. So at his age, it's quite possible that he has a pre-existing cardiac condition.
The result shows the patient is at risk of a heart attack and needs to be taken to hospital immediately.
English. Are you coming to hospital with us?
我们服从你的安排。
Yeah? See?
We did a lot of practice on mannequins, but walking into a real job with a real patient is a whole different ballgame.
Thank you, 谢谢。
Oh, that's okay.
Don't be afraid to clear people. So don't be afraid to clear people out of the way because he's got chest pain. Which way are we going? This way? It's all right. You'll be good. Okay? Stay in the back. Stay with your patient. Thanks, mate. Stay with your patient. How's his ECG looking and how's his pain?
It's normal, pain's the same.
Are you happy for me to move?
Yeah, I'm good.
I'm the paramedic now, and I have to keep pinching myself. I can't believe that I'm doing it. It's huge. It's massive.
So just run through a checklist in your mind of what's done, what you've got to do, you know?
His stats are back up at 99. Pulse is still 80.
How's our pain?
Stats are good. Blood pressure has gone down, but the pain's the same.
Go out the side way. That's all good. There he is. He's good, isn't he?
It's nice to know that I'm on that other side now, and I can't imagine going and doing a normal job after this. I don't think I could do it.
Laura, how do you feel? How do you think that went?
Yeah, it was full on, and obviously we did kind of like a brief in the car on the way up, and you were like, these are the questions you need to ask. So I was going through that in my head, and then we got there, and I asked the first question, and then I realised you couldn't speak English, and I was like, okay, well, I'm done.
I think you did well. That's a pretty nerve-wracking first job in public at the airport.
Yeah, thank you.
No worries.
It's close to noon at the control centre, and call takers are answering an emergency call every 27 seconds.
Ambulance emergency, tell me exactly what's happened.
I don't know, he swallowed it and he stuck on his throat.
What did he swallow?
His teeth.
It's like fake teeth.
Yeah, full.
Not every call requires an ambulance. Learning which ones are priorities is a big part of the job.
Okay, tell me exactly what happened.
No, you drink something.
Can you tell me what's happened?
My son, he drink drugs or anything.
He's drank too much?
Yeah, I don't drink for that. You take something.
Yeah. So has he had alcohol or drugs?
I don't know. So now, Okay, I got down the now because I got it for you.
You know what? You just take it as it comes. You never know what's going to be on the other end. So once you answer that phone, that's what you've got.
Ambulance emergency, tell me exactly what's happened.
There's a man just taking his clothes off, running out in front of the traffic. Now actually laying down on the ground. Yeah.
All right.
He might need some assistance.
Is he awake?
Yeah.
Is he breathing?
Yeah.
I feel like you take a lot of calls on a daily basis, generally of the same nature.
Some person just trying to get him a jacket.
Bless. Thanks for your help. Bye. It's kind of hard not to laugh at those kind of things because you get a bit of a visual in your head of some man running around naked in the middle of the street.
It's going to be one of those days. The way that my morning has started, it's going to be one of those days. We can roll with it.
Ambulance emergency. Tell me exactly what's happened.
It was at a form where had a call probably of 3-4 metres.
Is there any serious bleeding?
He's got a gash to the back of his head.
So we just don't want him moved unless it's absolutely necessary. Just tell him to be nice and still there and wait for help to arrive.
City got Inspector 34.
Inspector 347.
We had a call for someone who was fallen in a construction work site. The patient's fallen approximately 4 metres.
Okay, no problem at all. I'll advise. We're not far off location. So it's a guy fallen off some scaffolding or something.
Each year in Australia, approximately 25,000 falls occur in the workplace, resulting in serious injury. 3 emergency vehicles are converging to the building site in Sydney's west. 2 ambulances, including an intensive care paramedic, are coming from the east, while Duty Operations Manager Brian is driving from the west, 9 minutes away.
Oh, mate. That's where I wanted to go, dude.
Well, he's the hardest working person in the ambulance service of New South Wales. And the smartest one too.
I've been in the job 28 years. For me, after being exposed to so many different types of incidents over the 28 years, having that sixth sense about what's going to happen or how something's going to play out potentially may save the life. Seriously, come on, people. What I do know, experience has told me that time and time again, patients who have fallen from height, generally, there's got to be a consequence for them.
Inspector 34 is on scene now.
I better grab a hard hat, I reckon. Where are we going, guys? Hello. Yeah. How many stories?
Couple, because you go up, it's still a construction office.
Yeah.
Intensive care paramedics are already treating the patient on one of the upper floors, but the full extent of his injuries is unknown.
Yeah, you there, Brian?
Yeah, mate, we're just making our way up to you now. We've got a Stokes, spine board and some straps. You need anything else?
We're in priorities. Calling us spine board first, Stokes second.
Yeah, roger, mate. Just give us 5, we'll be up with you. Who's the supervisor? No, I need to show us the way up. We know statistically for people that fall from heights of greater than 3 metres generally end up with a significant injury. And in most cases, the obvious injury may not be the most life-threatening. So we just have to minimise the on-scene time.
I'll go up there, you can pass that to me if you want.
Is this the only way out? Wow. I mean, this is going to be fun. Straps. All right.
What we're going to do, we've got this big plastic board that we're going to pick set the body. So if the pain gets too much, we just let it go.
So he's fallen from that height there, Andrew?
Yeah.
Is his pelvic symmetry normal?
It is normal.
The main issue is obviously he's hit his head.
The patient has sustained an injury to the back of his head. The risk of spinal trauma is also high. They need to get him to hospital as quickly as possible.
Okay, whenever you're ready. Everyone ready? Some injuries you can't detect. Do they have brain swelling? Have they got an intracerebral bleed? We can't see. They're the things that we can't, as paramedics, detect. How you going, mate? We're going to get you out of here shortly, OK? What's the best way out? Same way we come in, or...? We find people in some of the weirdest places to get them out. And depending on the level of trauma, every second that ticks by can literally mean the difference between life and death. Can we come out there? Nah. Mate, are you serious?
Getting the patient out on a stretcher the same way they came in is impossible. Brian needs to work out how to get him down to the ambulance.
It's looking pretty nasty, isn't it? Look how narrow it is. What's the best way out? Same way we come in, or...?
At a construction site, Duty Operations Manager Brian is treating a patient who's fallen from a height and injured the back of his head. There's risk of brain damage, so they have to get him to hospital. But carrying the patient down to the ambulance is proving to be impossible.
Can we come out there? Nah. Look how narrow it is. I guess one of the things about being a paramedic, sometimes you've got to just be inventive. Work for that solution. And when you find the solution, it does work. So what I was thinking, we'll put the stakes here, and then we'll lift him up and then load him in there, put him in the pillbox on the crane. Yeah, I think it's probably going to be the best way to extricate him.
Brian decides the safest way to get the patient down is with a crane cage. But there aren't enough paramedics to carry him out of the tight space he's fallen into. They'll need help to put him in the cage.
What we do need, though, we just need some guys just to get us across from here to the cage. Yep. Guys, what we'll do is we'll pull him out and then we'll hand him to you. So rather than a lot of people moving, OK? So just, guys, everyone be aware. See where this guy's standing here? Don't knock him, because he'll fall down that hole. All right, you guys right? How about we just slide first? Elbows in. Yeah, that's all right. We're going to go to another beam. OK. So pass them up to these guys and just hand over hand, use our carry. Handles on the side, guys. Support the weight, guys, and we lower him down together. It's going to be easy going across here.
Dilly there, mate. Dilly there.
Drop him down this end. All right, that was tighter than it needed to be. Being a paramedic is about having experience. One of the things you'll learn after being a paramedic, as long as I have, is that you need to have a little bit of MacGyver about you to be able to overcome a problem.
Might get a little bump here, so you're coming down nice and down.
You don't find that in a textbook. That is just paramedics thinking outside the box. Prepare to lift, lift. Hold it up. Prepare to lower, lower. That's a nice way down. Better than walking down, eh? It's a good means of extrication. That's the best way. It's like a magic carpet ride. To be working in such a highly focused team, irrespective of where you work, is very rewarding. We all have a common focus, and that's to provide care to the patient. That's what makes the job. All right, mate. You're in the best of hands, OK, buddy?
It did have a long fall, but the patient's quite stable. He's being loaded up into the ambulance and being transported as we speak.
Our work here is done. All right.
Okay, listen. Stop yelling, okay? If she's having trouble breathing, yelling's not going to help, okay? So tell her to calm down.
It's mid-afternoon and the control centre is dealing with a sudden influx of calls.
Is there any serious bleeding? They're bleeding, but too much bleeding. Please help me. What can I do?
Ma'am, you need to just keep the pressure on his head. That is what you need to do.
You need to be calm.
Ma'am,
yelling.
Ma'am, you need to remain calm. You yelling is going to make him more upset.
Over a 12-hour shift, a single call taker can answer more than 70 calls.
Victoria, don't worry about that. We're going to move past that.
They are screamed at, verbally abused, or threatened by almost 10% of callers.
Okay, don't swear at me. Listen to me. I'm organising help for you now.
How many times you ask? How many times you ask?
Don't get angry at me. I'm just making sure we're sending the ambulance to the right place.
The last 3 people I've taken calls from have yelled at me, you know, we need an ambulance now. As the day just gets on, everyone's just getting a little more anxious and a little bit more worked up.
Oh, gosh. I can't deal with it this afternoon. He just started yelling at me straight away.
I was at Centrelink before I was here, so still a call centre. It's different. Like the ones at Centrelink, they're abusive because they're angry. But usually here they're more abusive because they're scared or they're frightened.
You just deal with it. That's what, you know, that's what you're going to be getting.
There's the good things as well, and if you can make a difference, I guess that's why I do the job. I want to make a difference, so I guess that's what keeps me coming back.
Ambulance emergency. Tell me exactly what's happened. I've had an alarm activation.
Is that the alarm company?
Yep. I've tried to call the client on the phone with no voice contact, but I've managed to hear the client. She's calling, please help me. You can hear her? Yes, she just keeps saying, please help me. It sounds like she's a bit short of breath there. I'm not too sure what's going on there. Alrighty. She just keeps saying, please help me, please help me.
Okay, so I've got a car on the way to come out and help you.
423 Sydney. So we're going to an alarm.
Patient is calling for help, sounds short of breath.
City 4, 657, 657.
Laura and Blake are the closest ambulance, 8 minutes away.
This is a 90-year-old female. She's activated her medical alarm, but we haven't had any voice contact with the patient. I know from co-op that there's a lot of accidental activations. Having said that, though, it says in the note that she's calling out for help, so I would say it's potential for her having had a fall and not being able to get to the phone.
In Australia, 1 out of 7 people is aged 65 or older.
Clear left.
They might also be an invalid, bedridden or wheelchair bound, you don't know. You know, so
for sure.
We've got to take these things on board and think of all the possibilities.
More than 720,000 elderly Australians have received home support services of some kind in the past year.
We will take all the equipment with us. We'll take the 3 main kits.
Life pack and the drugs.
That's correct.
Yep.
The thing that I'm most worried about is the unknown. It's not knowing what's going to come.
It's the ambulance!
And being able to deal with things as they happen. Hello.
Why are you here? Why have you come?
We had a call from your alarm company. Do you have pain? You saw anywhere?
No.
And what about your breathing? Can you breathe okay?
I'm breathing okay.
Yeah, good.
But not perfect.
What about your heart?
We'll do a quick assessment,
Yep.
do some basic
Yep.
blood pressure. And your ECG, we'll do a 12 lead. So let's see what this one pops out. She's got some ECG changes. Right bundle branch block, and this one here, it's MI at the bottom there.
Yep. Is she on cardiac meds? I didn't see anything.
Have you ever had a heart attack before?
No. Our machine is telling us there might be something wrong with your heart.
The ECG shows a blockage in her heart. The patient needs urgent care to prevent a heart attack.
We're going to have to take you to hospital.
No!
I know.
No! My cat!
Your cat, I know.
I have my cat
You
to
need-
look after!
You need to come to hospital.
No! No! I'm not sick!
Okay, it's all right.
No! Please! I love my cat more than myself!
Cat's going to be all right.
We're worried if we leave you here.
Laura. She's not really capable of making a responsible decision about her own health.
Blake calls Duty Operations Manager Paul to come and assist.
Inspector 66.
Yeah, g'day mate, how are you? Look, we've got a lady, she's in her 90s, she's got some ECG changes. I really want to take her to the hospital because of the changes, but they're refusing. You can probably hear the anxiety going on in the background. She's very hard to control. So I'll see you when you get here.
Copy that, no problem, thanks.
The inspector is now on his way.
Okay, cool. Blake's gonna get the bed and we're going to take you to the ambulance. Do you understand?
No.
Yes.
No.
It's okay. It's all right.
It's our responsibility to extract that patient. It's someone's mum, it's someone's dad, it's someone's sister, it's someone's important to someone else.
Please don't be upset.
Hello there, how are you? My name's Paul, and we're here to help. I have to take you to the hospital. I know that you understand what I'm saying. Your oxygen levels are too low.
I don't care if I die.
I care. The law actually says that we have to look after you. Let's put your bed in terror. And then we'll look you. Your oxygen levels are too low.
I don't care if I die.
I care.
Laura, Blake and Duty Operations Manager Paul need to take an elderly patient to hospital. They suspect she might be having a heart attack. But she refuses to leave her house.
Blake's going to bring your bed into here, and we're going to walk you, because we have to.
Just try and relax. Try and relax.
Can I ask you something?
I'm just going to help you put your legs up. Hang on.
Can you open a tin for the cat?
We will feed the cat now before we go. I will. She'll be okay. We know she's very important. She'll be okay. Just try and calm down. Just take a deep breath.
Now, Laura's in the back with you, okay? You're going to be fine.
Yep.
So we've got our prints.
One of your concerns was the one of them came up as a STEMI.
Yeah, you're right, I know. I just then the anxiety's going to go again. It's going to give you some oxygen,
Listen,
okay?
I'm just going to put these are going to go in your nose, okay? It won't hurt. Just going to give you a bit of oxygen.
You want to kill me.
It's okay.
He wants to kill me.
Her anxieties are based on the fact that she spent a year in hospital. And she doesn't want to go back to hospital. She wants to stay at home. She wants to be, in home as much as possible. And it saddens me to have to do this to patients.
I understand.
These traumatic experiences, it's very important to keep the patient calm. If the patient's not calm, we can't do our job properly.
It's okay. I'm just going to put this on your arm. It's not going to hurt. I just need to put it on your arm, okay? Having been a patient myself, I know how scary, how overwhelming it can be.
I am a human being like you.
I know, and listen, I know it's really difficult to understand at the moment, but we're doing the best thing for you. If we came to your house and we didn't take you to hospital and something happened to you after we left, then we haven't done our job. We're here to help you. Okay, I know you're very upset. We left food out for your cat, okay? She is gonna be okay, and you will be back. Some people will cry, some people will yell and swear and get angry. You need to recognise the difference between somebody who's just scared and upset and is reacting in that way because of that, and someone who is actually, out to abuse you.
Can you understand how much I love my cat?
I know.
Can you understand how I feel?
I can, and I know you're very worried about your cat, but we're very worried about your health. It definitely takes a certain type of person to do this job. You could be the best clinician, you could be a doctor, but if you can't empathise with your patient, then you can't do this job. We have to get the tests, all right?
okay? I know, you're doing really well. Just try and relax, okay? Just sit back and relax.
Laura, you good to go?
Yeah. If you go to the job and you're nice to them, you make that little bit of effort to, you know, feed the cat or put the baby to sleep, then you're doing your job.
Day one.
Day one. Graduated yesterday. Thank you.
It was intense. It was really intense. I've never dealt with somebody who doesn't want us before. Normally, I'm hearing people that are like, hurry up, get here, we need you now. That's really new territory for me.
How are you feeling mentally? Because that can be very mentally draining.
Yeah, it was definitely tiring.
But I thought you handled it very well.
Thanks.
Yeah, well, you did.
At the end of the day, she got to where she needed to be, so...
She definitely needed to go to hospital.
Yeah, it's hard to know where the line is, like when you kind of just have to put your foot down.
You'll get there.
Yeah.
We all do.
If it wasn't for you, I'd still be there feeding a cat.
Yeah, well, there you go. You know?
So, it really is overwhelming. You need to be able to take a step back and remember that, you know, you've done your job and everyone was a trainee once. That's something that you really need to remember.
Look at that water out there. It is beautiful out there. Look at that.
I like this time of the year. I like, you feel refreshed, you know what I mean?
Yeah. I've been a paramedic for 32 years now. When I started in 1986, women weren't particularly welcomed.
You're looking really professional right now.
You certainly didn't go and do a man's job. People said I couldn't do it. So I have had to prove a lot of people wrong over the years. This shirt, I've grabbed the wrong shirt out. See, it's got a little buttonhole that's just a little bit too big for the button. Well, you have to be my mate and tell me if it comes undone.
Yeah, sure, I'll tell you as soon as I know this.
I did an entire code 9 with that button undone.
You're trying to get a promotion or something?
Shut up. You smart ass.
Ambulance emergency, what town or suburb?
Darlinghurst. There's someone here that's dislocated their knee. Is in a lot of pain.
Okay.
I'm a partner who has MDMA and cocaine. Hospital and vegetables. He's going a different colour now. He's going pale.
The ambulance is on the way, okay?
Yep.
Ambulance
emergency, what town or suburb, please? Tell me exactly what happened.
I come to notice she's my client. When I come, she comes the floor and she's bleeding.
So she's had a fall?
She's bleeding. Right in the mouth.
Is she breathing?
No, it's not bleeding. Did ambulance come? Ambulance come?
The ambulance is coming as quickly as it can, ma'am.
It's 95 on the way to that Peakhurst, please.
It's a 1A.
All right, 45 going to 1A.
Life-threatening emergencies like a patient not breathing require an intensive care paramedic. Edward and Carolyn are 7 minutes away. They will rendezvous on scene with another ambulance that's closer to Peakhurst.
90-year-old, it's not breathing, found on the floor, blood coming from the mouth. What are we up to? Okay, patient located in the back of the property. Peakhurst, I know exactly where that is. It's around the corner from my mum's house.
The first paramedics have arrived and send their report.
A 90-year-old female who's unconscious, not breathing, and it's a confirmed cardiac arrest.
Is a patient actually in cardiac arrest?
Yeah, you do the airway, I'll do the other stuff.
The patient has been down for almost 8 minutes with no heartbeat. They need to start CPR immediately.
Oh dear.
It's always the way. Stop. Stay with the just don't get out of the way.
Just here. When they're extremely unwell and potentially dying, turn right. You have to try and lessen the impact. They keep going up that way. It's going to be We're fixers. We go in and we fix. as best we can, and it's instantaneous. You make a difference to people immediately. We go into people's houses, they call us when they're at their lowest, and if we don't get them to the hospital alive, then there is no other care. Hey guys.
Hey guys.
Excuse me. Hi, how are you? Right.
Edward and Carolyn are on scene with a 90-year-old patient who suffered a cardiac arrest.
Was apparently found collapsed just in the garden there by the cleaners. Apparently she was alert at that time, but then apparently she's had about 10 minutes of downtime.
No CPR?
No CPR in progress before our arrival, no. So we've just done one cycle now with assist.
What are we in?
One side, got systole.
Yep.
IV access?
I've got it.
Okay.
She's had no heartbeat for approximately 10 minutes.
We're running asystole protocol.
With every minute, her chances of survival drop dramatically, so they need to get her heart beating again as soon as possible.
Counting in for the ventilations. All right.
5, 4, 3, 1. Okay, that was at 4:20. So
can you set me out with a 7?
Do you need a bougie?
No.
If they can get a rhythm, they can use a defibrillator to shock her heart back into action.
All right, everyone clear, oxygen away, stop CPR, check for the rhythm. Confirm that's not a shockable rhythm. Please dump that shock.
The flat line means there's no heart rhythm, so they can't shock the heart.
Back to CPR.
They start the CPR cycle again.
So we run this for 20 minutes and we'll see how we go from there, okay?
Good.
Thank you.
There you go. Even after all of these years, a cardiac arrest, it's still the job that gives me sweaty palms. Are you good there? To save that person's life, it's a very big responsibility. Okay, adrenaline, 1 in 10,000, 219.
Stop CPR. Oxygen away. That's a not shockable rhythm. Can we please stop that shock? Back to CPR, please. Print.
Right.
Yeah, thank you.
When I was young, my best friend's mother was taken away in an ambulance, and it was the last time she ever saw her. She never ever really got a chance to say goodbye, and I always remember that. Yes, ready to go. There's nothing you want more than to get that patient back to their family. So 4 minutes.
Okay, hold on, stop CPR. Yep. That's not a shockable rhythm. Everyone clear, dump the shock. Dump it. Dump the shock.
To maximise their efforts to restart the heart, they also inject her with adrenaline.
Please, thank you.
They top up the adrenaline every few minutes.
10:18.
Fantastic.
The paramedics have been doing CPR for 12 minutes.
Next adrenaline's ready.
Swap again, yeah. Good, ready to go, come on. Fantastic, well done.
Okay.
The dog
What
that's only
size?
14.
You getting anything? What are her pupils doing? Oh, fixed and dilated.
Stop CPR. That's a no shockable rhythm. Please cancel the shock. That could have a print. I could have a pulse. Let's quickly check for a pulse.
There's fluid coming up.
I had a pulse in that one. All right, let's start to set the tractation. Fantastic.
The patient has a pulse and they can stop CPR. But her condition is critical and she needs to get to hospital urgently.
I want to keep moving now because she's gonna make it. We need to keep moving.
The damage to her heart is unknown and her life is still at risk.
There's information on board. Can we get central drop for code 3, please?
$145 on 80. Okay, she's starting at 86. What heart rate are we getting on there?
60.
Right, that's good. So it's all marrying up.
2.2 milligrams of adrenaline will be there in 5 minutes.
Yeah. What are those pupils doing?
They are a bit better. They aren't reactive. They're about 5 mils now.
Just cannulating, Pete.
All right.
You got a pulse?
Front 2, front 1. Once we stop the car, we are not clear too early. All right. We stop now?
Let me get this on. Yep.
Okay. Excellent. All right.
Just 1 sec, mate. We're getting a 12.
They get the patient to hospital in a critical but stable condition.
Right, are you good here? When you're actually doing the job, when you're actually trying to get the best outcome for your patient, you're not thinking that what you're doing is heroic. You are too busy trying to save that person's life. And it's a good day if you do.
That's
job.
what we live for, eh?
Good job. You did a good job. That was good. And it's great for the family that they have their loved one back, or they get the opportunity to at least be able to say goodbye. And that in itself is huge.
She's reacting now. She has, the pupil are constricted, she's breathing. Like, how she goes in the next couple hours, no one knows, but it's the best case scenario for what we found.
There is no other job that really, for me, compares to being a paramedic. That ability to be able to make a difference, which is why I've stuck with it for such a long time. 32 years and counting. Do you want me to start?
I do the paperwork.
Do you want to do it?
I do it.
Do you want to do it?
While we do this.
It's part of the IC service.
Oh, shut up. Shut up.
Ambulance emergency, tell me exactly what's happened.
My mum's fallen down, she's not waking up.
How old is she?
I'm 75.
Is she awake?
Oh, my dad just called me now. He says that she's not waking up. She's epileptic.
Okay.
So she only coughs out at night times, not during the day.
Okay. I'm getting help you now, okay?
Please,
We've got a 75-year-old female, unconscious, not waking up, possible seizure.
Yeah.
Sometimes these turn out to be a cardiac arrest when you rock up, because people can't really identify when someone's, or they're reluctant to identify someone who's in cardiac arrest.
Seizures are one of those jobs that I dread going to. They're so time critical and quite complex. Really gets my adrenaline going because we need to get there, because when people are seizing, there's no oxygen going to their brain, and the longer that they seize for, the longer that their brain is starved of oxygen. So if we don't get there and administer our medication to stop their seizure, quality of life is going to be affected, or they could potentially die.
Okay, buddy. That's all right, wait. Ma'am, stop. I need to help her.
Tonight,
Day 2 of plus 40.
a record heat wave has the city at boiling point.
Have you got any tingling in your fingers or your feet? Keep your head still.
When it's 45 degrees, it doesn't take much to tip people off.
You've had a decent fall.
And a heinous act of violence
So a female that's been assaulted by her partner.
leaves paramedics reeling.
I know the heat brings out agitation and short tempers, but oh, sweetheart.
Unprecedented access from the control centre
Just like guys, I'm going to come and find you.
So there's no need to threaten me. I'm trying to get help to you.
to the paramedics on the front lines,
Back to 99 proceeding to the airport.
fighting to save lives.
Can you open your eyes for us?
These are the stories behind the lights and sirens of New South Wales Ambulance. Paramedics Marco and Shanae have raced to a 75-year-old female, unconscious after suffering a seizure.
Ma'am, stop. I need to help her. Okay?
Treating the patient soon is critical,
Ma'am, can we just get you out of there just so we can treat you, okay?
as prolonged seizure can increase the risk of brain damage and death.
Being on scene with a patient that their loved one's present and watching them in that state, it's very hard to manage that raw emotion, that feeling. They're pretty much thinking that their loved one's dying in front of them. And one of the hardest part of this job is to help that person through that situation.
Sorry, what's your relationship to this lady? All right. So this is your mum. Does she suffer from epilepsy?
Yeah, but only at night when she's asleep.
When was her last seizure? Does she usually have seizures?
Only at night when she sleeps.
Yeah, but is it quite often that she has seizures?
Not often, every 2 months.
That's pretty often.
When there's a language barrier, that sort of magnifies everything as well. It's obviously really hard to try and reassure someone that doesn't speak your language.
What's happening at the moment, your mother's having a prolonged seizure.
Yeah.
Can you find out off your father how long she's been in this state for?
About 18 minutes.
Seizure activity for more than 5 minutes is classified as prolonged seizure. The longer a prolonged seizure lasts, the higher the risk of brain injury.
What I need you to do is get her medications together for me.
Prolonged seizure is a risk for the estimated 250,000 Australians living with epilepsy.
I'm going to give her some medication to stop the seizure and we're going to take her up to hospital, okay?
We have a very strong medication that we administer to stop seizures, and if that's not working, then this patient needs to be in hospital, and they needed to be in hospital probably 5 minutes ago.
So, is your mother allergic to anything?
No.
No? Does she take any other medications for anything else?
Blood pressure.
So she has high blood pressure? Any cardiac issues?
No.
Watching these people go through this, it's heartbreaking. It can be quite traumatic looking at us putting needles in, putting tubes down their throat.
Sorry, ma'am, can I just get you out of the way for a second?
I certainly wouldn't want to be watching that if it was my loved one. So it's really important to include them in what we're doing and try our best to make it less traumatic for them. You want them to feel like you are doing everything possible.
So she stopped seizing now after that medication I've given. All right, but we're going to go up to hospital. I've just got another crew coming. Joanna, can you squeeze my hand?
After 20 minutes, the patient has stopped seizing, but she is still unconscious.
She's never had this type of seizure. They only last a few minutes.
Never problem like this all in my room, my sleep.
Yeah, so she usually has wake-up seizures.
Yeah, okay.
Wake-up seizures, or nocturnal seizures, occur during sleep. It's estimated only 12% of people with epilepsy have nocturnal seizures.
1, 2, 3, 4.
So you go first, ma'am.
It's a job where you come across people at their most vulnerable, and being part of that process of helping and caring is something that's very special and unique.
Given the severity of the seizure, both Marco and Shanae will stay with the patient as she's moved to hospital.
Sustained seizures. I've been fortunate enough to only have 3 of them in 10 years, and one of them was a little child, and I've never been more terrified in my whole life, and to the point where I couldn't follow up what happened to them because I was too scared.
Hello, my sweetheart. How are you feeling? You've had a very big seizure this morning. You're in the ambulance.
After 35 minutes, the patient has regained consciousness.
Can you wiggle your fingers for me? Good girl.
Despite having epilepsy, this is the first time the patient has had a prolonged seizure. She requires further tests to uncover the cause and to prevent further incidents.
Epilepsy it's just a devastating condition. It affects every aspect of these patients' lives. Some people aren't able to have driver's licences. Some people can't work normal jobs. Some people need full-time carers. How they manage to live normal lives as best they can with this condition. It's incredible. They're amazing people.
It's the start of the day shift, and paramedics are preparing for one of the hottest days of the year.
So, day 2 of plus 40.
Oh.
Definitely need to drink more water today.
Yeah. Dude, I don't have sunglasses again today. No sunglasses is supposed to be the hottest day on earth.
I can't deal. I've been here, what, 10 years, and I'm still not acclimatised to mainland weather.
Really? Doesn't get to 40 in Tassie?
It's 22 and everyone's dying.
Ambulance emergency, what town or suburb?
It's 9 a.m. in the Sydney Control Centre, and the temperature is already approaching 30 degrees in some suburbs.
Have something there to keep you cool. If you dampen a face washer and maybe put it on your forehead.
December and January this summer are on their way to being the hottest ever recorded in Australia.
They said there's going to be a 17% increase in emergency admissions today. We should be expecting a lot of people that'll be dehydrated, feeling faint.
So he fainted and fell out of the golf cart, did he?
Yes. Ambulance emergency. Tell me exactly what happened. My wife overheated. She's overheated.
During heat waves, ambulance call-outs in New South Wales go up by more than 10%.
She's been lying down all day. She's barely eaten. I think the heat waves get into it. My 18-month-old son, he feels hot, very hot.
And in summer, 50% more people visit the beach on a weekly basis.
Ambulance emergency. Tell me exactly what's happened.
So there's a 13-year-old female with a suspected spinal injury.
Do we know what happened? She jumped in the water? Or...
So apparently a board has hit her in the head.
Okay, I'm organising help for you now. Stay on the line and see exactly what to do next.
The beaches are common areas to get jobs over summer. People being done by waves.
Duty Operations Manager Paul is en route to the injured 13-year-old. A paramedic crew in Ambulance 417 is about to arrive on scene. Paul is just 4 minutes behind them.
Worst case scenario with the trauma with being hit in the head by a surfboard is either having bleeding on the brain or receiving a spinal injury that causes damage that's irreparable that changes the patient's life.
In Australia, around 234 people become para or quadriplegic each year. At the scene, it's Paul's job to manage crews and ensure all necessary care is taken.
Hello, guys. Hello, mate.
So 13.
Yep.
In the bathroom. Flat board. She's got some cracks. Okay.
What was your first name?
Mackenzie.
Mackenzie. Do they call you Macca for short or something?
Yeah.
All right. Are we all right to call you Macca?
Yeah.
Excellent.
Macca.
It's the most crucial thing to make a child feel so safe and comfortable whilst you're at a job. What worries you the most? The pain in your neck?
Yeah.
Spinal injuries require a fast but really methodical way of treating it.
So this is going to feel quite tight.
Yeah.
Okay, you tell me if it's
Right.
pinching your ears.
Do you want to get your finger out? Big thing with this collar is don't drop your chin too far.
Okay.
Are you able to keep it up like that for me?
Yeah.
You're a good girl. If a fast response isn't provided to these patients, the patient can deteriorate to a point where they become quadriplegic or paraplegic. You know what your job is? Keep your head still.
Okay.
That's the only job you've got.
Okay.
All right? Have you got any tingling in your fingers or your feet?
No.
No, and when you say no, you're not allowed to shake your head. You got to keep your head still. One job. You got one job.
Okay.
What was your job? What was your job?
Not to move my head.
Correct. What we're going to do is we're going to put you onto this bed, on this board,
Okay.
and then we're going to roll you. We're going to take this board away, and you'll be on a bit of a softer bed then,
Okay.
and we'll take you up there. We're going to slide up towards you. No, that's okay. When we move this patient, we've got to be really careful that we keep the spine in line and that we don't bump it and we don't move it aggressively. We don't move it in any way that's going to cause further injury. What we don't want to happen is for a stable neck fracture to become an unstable neck fracture and cause some serious spine injury. See you girls, see you at the next one, bye.
Paramedics in ambulance 417 will transport the patient to hospital for full spinal scans.
As a parent, I hate to see any child at risk or in pain. I look at these kids the same as my kids. This young girl is the same age as my daughter. The damage that can be caused to the spine can cause her to be either in a wheelchair or not being able to move her arms and legs for the rest of her life. I've had to deliver terrible news to parents and it breaks my heart. But I hope this patient is not critically unwell.
Ambulance emergency, tell me exactly what's happened.
Well, mate of mine just collapsed. It was like he might have had a heart attack.
Okay, is he awake?
Hey? Oh, no, I'm not there, but I'm on the phone to you.
It's 12 p.m. and across the city, temperatures are rising rapidly.
Does he have a history of heart problems?
Why don't you come and find out?
You know the term when you say someone's blood's boiling? Well, when it's 45 degrees outside, it doesn't take much to tip people off.
It's your brain, buddy.
Sir, you don't need to abuse me, so just listen to me.
I'm confused about it, mate. You don't know how to use your computer. Yeah. Tell you how to get in.
Everyone's just a little bit less patient, a little bit more desperate, a little bit more irritated and aggravated.
What's your name, mate?
My name's Josh.
Josh what? This bloke dies, I'm going to come and find you. Telling you.
Well, see, there's no need to threaten me. I'm trying to get help to you.
Sorry, I'm not threatening you. I'm giving you a promise. If you can't get
Sir, stop swearing. You're talking to a supervisor now. Now, you are delaying the ambulance, so please try and help us to get the ambulance to the person that needs it quickly.
You're right, it's okay.
Sorry, you have to deal with that. It's unacceptable. Josh is very new in the jobs. He dealt with that exceptionally well. But you know, that's not saying that call takers that have been doing the job for, 15 years, it doesn't affect them.
Each year, New South Wales ambulance call takers will be abused by nearly 10% of callers. With more than 1 million calls received each year, that's nearly 100,000 times.
Ambulance emergency, what town or suburb, please?
It's hard. I get nothing out of swiping.
Yeah.
It doesn't tell me anything about a person.
Even though the girl has to message the guy first, I feel like I still end up making the effort because you just get, hey, hi, hello.
Serious?
Hey, Charlie.
In ambulance 303, Charlie and Danny are waiting for their next call out.
Let me see.
She doesn't even have anything written on it, so.
It's just photos.
Just photo.
They're all from the same angle.
Hello. It'd be good if you could just go up to a cafe and be like, hello, my name's Charlie. Would you like to get some coffee one day? Go from there, you know what I mean? Like the good old days.
Sydney to 303. So guys, can we keep you in for an assault to immediate?
303, no problem. So I've got a female that's been assaulted by her partner with injuries to the face, possible broken nose. Police are en route.
Charlie and Danny have been called to the scene of a domestic assault. Police will arrive first to secure the patient's safety so paramedics can treat her.
The domestic violence jobs are definitely the harder jobs. It's like a pit in your stomach. I mean, I know the heat brings out
agitation and short tempers, but sometimes we walk into situations where we're the first on scene and police aren't there, and there's still an angry husband or wife on scene that can be quite aggressive, and protecting the patient is paramount. You need to secure the scene not only for your patient but for yourself as well. Oh, sweetheart. So I've got a female that's been assaulted by her partner with injuries to the face, possible broken nose. Police are en route.
Charlie and Danny are travelling to the scene of a domestic assault. They're just minutes away.
Domestic violence, it's so prevalent in our society these days. Like 1 in 6 women. That means that there are cops and ambos and doctors and nurses and lawyers and all sorts of professional women that know what this is like. I have been unfortunate to be part of that statistic. It's my responsibility to be, as helpful as I can for that patient. Hello, darling. Oh, sweetheart. My name's Danny.
Hi.
Hi. Where is he right now?
He's in that house.
Is he with police right now? Okay.
Now the patient is safe, Danny can assess her injuries and transport her to hospital.
So did you lose consciousness at all?
I think I blanked out for a minute. He strangled me first.
Yeah.
But I ran. But then he kicked me down. He had me down and he was just kicking into me.
Was he barefooted or a boot?
He had shoes.
So you've copped multiple stomps to the face.
Yeah.
We're not trained to the extent of social workers. We're there to look after their health, essentially, and limit the amount of damage that has been done to them physically, and trying to, just offer that support on the way to the hospital, really. Has this ever happened before?
Yeah.
All right.
But not this bad. I've always managed to escape from him. He got me this time so bad. I've never given him the opportunity to really get me.
Good on you. You've gotten away. You've done everything that you can and you've called us. You do what you can to get out of there.
I just needed somewhere safe.
Yeah. It takes a lot of strength to walk away from something like this. How's your pain?
I just don't know why he did it. He had no reason. I did nothing wrong.
You haven't done anything wrong whatsoever. This is all on him.
Yeah, he's got a problem.
Yeah. When I hear them tell their story and describe the things that they're going through, it's sometimes quite hard to stop myself from becoming emotional. The Danny on the inside just wants to wrap her up in the biggest hug and just let her know that everything's going to be okay.
I just walked in and next minute he's on me.
So you've had kicks to the face. You said at one point...
He hit me first.
Yeah. Has there been punches as well?
There might have been 1 or 2, but he kicked me mainly.
Okay. I really wish there was a little bit more understanding of how complicated these situations are. It's never that simple. These are 2 people that have a history together. Have you ever sought any kind of help from domestic...
The times that I try to see domestic violence officers, he tells me everything's going to be all right and he'll never do it again.
They say that, don't they? It's pretty isolating, and that feeling of helplessness can stop you from saving yourself. You don't deserve to put up with that. This kind of thing always gets worse.
I know he's getting worse, but I can't get away. It's too hard.
But this behaviour,
It gets worse and worse until the worst possible outcome happens and your family loses you. That's how this ends. Letting her know that she doesn't have to go through any of this alone is pretty important. All right, sweet. You're just going to come out the back doors now, okay? You walk away from those patients just hoping that something you've said or done has made a little bit of a difference in their life. You don't get to see the results, so you're just left with that hope that something has worked.
Imagine what it'd be like to be in a relationship like that.
It just sucked. Because there's all that emotional abuse that comes with it. The whole beat the crap out of you and then immediately show remorse and say you're sorry, I love you, all that sort of crap.
Yeah.
And then make you feel guilty thinking that you deserved it somehow. Yeah, and you go back.
Yeah. Poor thing.
There's a lot of shame that comes with being a so-called victim of domestic violence, and I really wish that we could wipe away that stigma, because they don't deserve pity. They deserve understanding and support.
Ambulance emergency, tell me exactly what's happened.
So I've had a female on the platform. She is feeling ill and vomiting. She's been up in the mountains all day hiking, so she potentially maybe have heat stroke.
It's 3 p.m. in the control centre and there's still no relief from the heat or heat-related calls.
There's an old man in here and he's on the verge of collapse. He's severely dehydrated, shaking, he's very old.
And this 74-year-old lady has gone into the steam room at a leisure centre and she's collapsed twice.
I only have to walk outside in this uniform to be in a steam room.
In New South Wales, around 45% of emergency calls are for elderly patients.
All right, I'll try and send my best-looking paramedics, okay?
Okay then.
The risk of heat-related illnesses increases in people over 65.
Breaks my heart. 92, 93 in March, suffering from heat exhaustion in Bathurst, which would have been in well excess of 40 degrees today.
It worries me because the oldies they just don't tend to spend money on air conditioners. So fans really aren't going to cut it, I think, in these temperatures.
Ambulance emergency, tell me exactly what happened.
The man that's been on my lawn has collapsed and he's barely able to walk.
Do you have a history of heart problems?
No.
Okay, I'm organising help to you now.
75-year-old man mowing lawn collapsed.
Oh, it's too hot to be mowing your lawn.
In Western Sydney, Charlie and Danny are responding to the heat-affected patient. Outside, it's 41 degrees.
This is my 8th summer that I have worked. Most of it has been out west, where it is the hottest. 40 degrees is probably not the most comfortable kind of heat. It lends to some unexpected events and, you know, that's when accidents happen. G'day, mate. What's your name?
Arthur.
Arthur. Nice to meet you. My name's Danny. This is Charlie.
G'day, Arthur.
I understand that you went down on the stairs out the front there. I'm going to check your blood pressure and see how that's faring. I think we found the culprit. Your blood pressure's sitting at 100 systolic. Has it ever been that low before?
No.
No. Yeah, it's on the lower side of normal. What I'd like to do is just stand you up and see how you feel when you stand up, and I'll check your blood pressure again and see if there's any drop or change. An elderly person working in such significant heat, it's not unexpected to see them have a faint, but Something so simple, something so mundane could spell something more serious. Did you have any glasses of water after this episode?
No,
Okay.
nothing at all.
All right, you can have a seat down again. Thanks. Yeah, your blood pressure does drop when you change position. Did you lose consciousness for a long time, or no? You just felt so faint you went down to the ground. So there was no... Yeah, you caught him.
I caught the head.
And then you caught the head, the most important part. Good on ya. Good wife. Oh, I love it. How did the two of you meet?
His mother died.
Right.
And I sent a sympathy card.
Ah.
And I've got a letter back asking who I was.
Oh, there you go.
We met in September, engaged in December, married in March.
You're joking. I've got a bit of a soft spot when it comes to the elderly. I guess because they are more vulnerable than your average person out there in the community. You try a little bit harder to keep an eye out for them. What it looks like is that you're just moderately dehydrated. We would always recommend a trip up to hospital just for some tests and make sure that everything's okay, and make sure that you get to that right level of hydration again, and make sure that there's nothing sinister underlying, because our tests that we do in the home are very basic.
Yeah, we'll just be on the safe side.
Yeah, you happy to come up?
Yeah. Alrighty.
No worries.
Arthur's condition is currently stable, but he requires transfer to hospital for further tests and rehydration.
The lawn looks good.
So this is your place?
No, it's John's.
You're mowing your friend's lawn? Right, so you've been mowing a few people's lawns in all this heat.
Yeah.
It's a small miracle you've managed to stay hydrated.
Too stubborn.
It's particularly important with our elderly to take those extra precautions, especially if they've lost consciousness at any point, because something as simple as a bump to the head or, you know, a little palpitation here and there, they could be the symptom of something more serious. I think this is a perfect way of your body telling you you're not 35 anymore, it's time to slow it down and enjoy your 70s.
Yeah, well, just they were so long and had to be done, you know, didn't want to get any worse.
It could get done at 7 o'clock tonight, it's all good. Such a warm and fuzzy feeling having people like that in the ambulance. Woo, she's hot. Getting to know little snapshots of people's stories. It's one of the best parts of the job, really.
It's been a hot day, but a late storm is finally bringing some relief. At the control centre, though, calls aren't slowing down.
Emergency, what town or suburb? It's Sydney Domestic Terminal 2. The female has fainted. They've commenced CPR. She's not breathing.
Okay. You've obviously got your defibrillator on scene there and everything?
Yeah, here.
Back to 99 proceeding to the airport for a code 2.
Multiple units, including intensive care paramedics, are sent to cardiac arrests. Dispatched to coordinate them and the scene is Duty Operations Manager Mick.
Knowing that this patient's in cardiac arrest, it's important that I stay very calm so I can concentrate on overseeing exactly what's going to happen.
At the scene, airport personnel are already conducting CPR. Mick is following a general duties ambulance. They're just 5 minutes away. An intensive care team is also en route with an ETA of 8 minutes.
Second car's been 4 minutes off you there, I love it.
Thanks, Jeff. A lot of people, when they do their first aid training, they're very, very fearful because it's probably the worst event that could happen to somebody. It's the event that happens before you die, is a cardiac arrest. Sydney Airport is one of the busiest places that we attend. I'm thinking about how we're going to get the person off the aircraft if they're still on the aircraft. How we're going to get them off the aero bridge, how we're going to get them out of the terminal. Still unconscious? Well less than 10% of out-of-hospital cardiac arrest survive. Patient's critical and their chance of survival is very, very small.
So, everybody, just nice and quiet for 1 minute. We'll tell you what we're going to do.
After disembarking a flight at Sydney Domestic Airport, a woman is in cardiac arrest.
Can I just move all this out of the way, please?
99, thanks.
An intensive care team is en route and Duty Operations Manager Mick is responsible for her treatment.
Everybody, just nice and quiet for 1 minute. We'll tell you what we're going to do.
The patient's heart had stopped for several minutes.
You're going to be able to get something there.
But has been restarted with a defibrillator.
So the lady now has a good, strong pulse.
Despite having a pulse, the patient is still unconscious and needs oxygen to prevent brain damage.
Yeah, so I'm going to try to get IV access, and then what we're going to try to do is, we'll just, I think she's a bit light now, but we'll try to put an LMA in.
With the patient's breathing unstable, Mick is preparing to place an advanced airway to assist.
And what we probably need to do as well is set up for a 12 lead. I think it's important to know the responsibility we have as paramedics. However, considering that their life is in my hands, I think I'd be lying if I said I wasn't nervous at all. I'm going to put a Goodell's in, but I don't want her to vomit. I've lost count how many cardiac arrests I've done. It's a very hard job because the difference is this patient's either going to live or die.
Hello? Can you open your eyes for us?
She's conscious now, so we won't put a Goodell's in. Hello, my name's Michael, okay? You've had a turn at the airport, okay? We think you've probably had a little heart attack. Okay, your heart actually stopped and we've had to do CPR on you. We're going to take you to hospital, okay?
The intensive care team arrives and will monitor the patient as she's transferred to hospital.
You right with that? Okay, don't hurt your back, just nice and slow.
Around 40% of patients re-arrest when resuscitated away from hospital, so observation is crucial.
3, and we'll head down the stairs. Yeah. You're doing really well, darling. Raining in Sydney, eh? This lovely lady, after suffering a cardiac arrest, probably didn't know where she was. Holding her hand, stroking her face, talking quietly and calmly to her and telling her who we are, what we're doing and what's happening is really important. Fabulous job by everybody. There's a less than 10% chance of surviving an out-of-hospital cardiac arrest. And of course, if you are going to survive, the place to have a cardiac arrest is where there's a lot of people around. And of course, one of those places is the airport. There's a lot of first aid trained people there. There's police, there's firefighters, and there's a lot of defibrillators. So 100% she's the luckiest woman in Sydney today. Any paramedic would be lying if they didn't go home and say some days they have bad days, but some days we have really good days. And take the good with the bad.
At the Sydney Control Centre, it's the start of the night shift and calls regarding intoxicated patients are coming in.
Ambulance emergency, tell me exactly what's happened. My husband has had something too much to drink and he started coughing in his sleep and he can't get up.
My son's not breathing properly and I'm trying to rush him to the hospital. He took a drug.
Okay, what did he take?
Ice.
Okay, did he take anything else apart from the ice?
No.
He just hit him straight in the face and he dropped backwards and hit his head on the concrete. And he is lost.
Having been a paramedic for 10 plus years, there's a noticeable difference between the nightlife in Sydney over the summer. There's a lot more people in and out of licensed premises. It can also mean a fair bit of alcohol-related harm.
I've got a 20-year-old male here. Looks like he's fallen approximately 3 metres.
Inspector 67, copy that. Negative code 2 and a long fall POTS point.
Duty Operations Manager Jordan is reassigned to the scene of the long fall. He's 4 minutes away.
The caller has said that a male has fallen greater than 3 metres and he's sustained some sort of head injury. And that's significant for us because if a fall's greater than 3 metres, it meets our major trauma criteria.
A major trauma accident requires multiple crews. Jordan and 2 other ambulances will attend.
We've gone past this nightclub a couple of times this evening. It's really been raging all night, so I'm not surprised now that we're responding to a serious incident here.
A fall greater than 3 metres can very easily be fatal. When you add the element of height, the risk of more serious or catastrophic injuries really spikes. I'm thinking fracture to his long bones, fractures to his arms and wrist, potentially spinal cord injuries as well. You're also thinking open and closed head injuries, so there is a really significant mechanism for very serious injuries in this guy.
Duty Operations Manager Jordan is at a nightclub where a man has fallen from a height greater than 3 metres.
I think it's possibly landed like on his chin peg, but maybe onto this. Yeah.
He's pretty drunk, or?
He's very drunk.
Yeah.
The top of that?
Yeah, so he slipped down and it's on. Yeah.
Witnesses say the man climbed over the first floor balcony and slipped. He's fallen approximately 5 metres into a concrete wall before landing face first on the pavement.
Those injuries could alter the course of his life.
Quick blood pressure on him, Joe.
Yeah, I've seen young people that have suffered incredibly because they might have done some silly stuff and it's changed their lives forever.
Let's focus on getting the bed set up here, maybe some collars as well.
I think the times that these jobs become more challenging is when the person who's fallen is impaired by alcohol.
My name's Jordan. What's your name?
Jesse.
Jesse.
I have feelings
Yeah, but that's why we've got to put this collar around your neck.
Is this guy confused because he's just had 10 beers, or is he confused because he's hit his head and he's got a slow bleed onto his brain?
Because alcohol can mask more serious injuries, Jordan takes all spinal precautions and will transport the patient to hospital to check for internal injuries.
We're only doing it because you've had a decent fall. Yeah.
How are you? Just keep your head still.
Stay still, champ. We're going to put this thing on.
No worries.
So this will be a little bit uncomfortable getting it on, mate. Sorry.
I'm sorry about all this fuss.
It's all right, mate.
No, I just want to say I greatly respect what you guys do.
Thanks, pal. Legend.
Sticking out for everyone like me.
Nah, it's all right. You're all right. You look like you're having a good time.
I am having a good time, I'll say that.
Too good a time.
My advice to young people is look after one another, because it's easy for bad things to happen, and you should call us and we will come and care for you without judgment.
Despite the height of the fall, initial assessments haven't uncovered any life-threatening injuries. But the patient will undergo a series of tests to rule out any serious trauma.
Just doing this to have a quick look at your heart again, mate, just as a precaution.
One of the most important things about being a paramedic is reassurance, and it's not always just reassurance of the patient.
He's had a fall off a sort of landing, and he split his chin open and he split his lip open as well, all right? But he's conscious, he's talking to us. He might have had a brief loss of consciousness, but there's no sort of obvious injuries other than those injuries to his face, okay? All his vital signs, blood pressure, heart rate, all of those are really normal. He's happy to quickly have a chat to you. 1 second.
Hey, Mum. Sorry about this.
This could be a very different phone call. I've been to other cases before where people have fallen from the same height and unfortunately died as a result of that fall.
Bye.
Whose phone's this?
I have no clue, eh? What's the fall?
5 metre fall.
Oh. No way.
Yeah.
Are you serious?
Yeah, I'm not even lying.
That's crazy.
Yeah, no, you did pretty well for a 5 metre fall.
Look, yeah, I think I've got to say, hey.
Because you're such a positive guy and all.
I said, are there more to go? Because I just wanted you to go home, to be honest.
I know, mate, but you've cut your whole lip open.
Have I?
Yeah, and you put your teeth through your lip.
Oh, shit.
Yeah. Your modelling career's over.
The most rewarding part of the job is being able to support and bond with your fellow human beings in those difficult times. It's kind of pretty powerful to stop and think that there are people walking around today who wouldn't be because of stuff that I might have done over the last few years.
Ambulance, what's the town or suburb of the emergency?
Ambulance, what's the town or suburb of the emergency?
Ambulance, what's the town or suburb
Ambulance, what is the town or suburb of the emergency?
I'm trying to help you. You need to listen to me, okay?
So he's got a large laceration to his head.
And how many people are hurt there?
He said he could see his skull.
So we are coming lights and sirens, so we are coming as fast as we can.
Assaults.
Don't move the patient.
Drinking.
Okay, can just stop for a moment?
Car accidents.
Just one vehicle involved.
Shenanigans have begun.
In the Brisbane Operations Centre, the notorious Friday night shift is well underway.
It's literally when the sun goes down and you just think, it's really happening like it's on here.
On average, call takers will answer one call every 70 seconds.
All units, I have a code 1505246. I think you are closest.
Each job is assigned a code.
And what colour are her lips now? Are they still blue?
Which determines who gets helped first.
No, you haven't been forgotten. Her husband's been on the floor for an hour.
And where you sit in the queue.
206 guys, have you closer for a code 1 now. Put it through for a possible downgrade. 384, I will send you to a 2 Alpha. Roger, thank you.
Tonight, 87 paramedic teams along with 17 single responder units are covering the Brisbane metropolitan area.
Ambulance, tell me exactly what's happened.
Someone got shot with a gun.
He got shot with a gun?
Yeah, like a nail gun.
A nail gun?
Yeah.
So not a rifle?
Yeah.
Is it a proper gun, sir, or is it a nail gun? There's a big difference.
He's just got shot. I don't think what else you want to know.
Due to the potential severity of the incident, it's coded as a 1A, lights and sirens. Senior Operations Supervisor Dan is dispatched to manage the scene in case the injuries are critical.
The original case came through saying that it was a query being shot in the neck by a nail gun.
You there, love?
Yeah, so I'm just trying to confirm. He said it was a nail gun, but he also said it was a gun.
Yes.
What was it?
It's a nail gun.
A nail gun, okay.
No, 22 bullet. The 22 bullet he's talking about.
So it is a proper gun?
It's a proper gun, but there's a bullet there. Wow.
Alpha 505302, there were conflicting notes in the case, but the latest one confirmed it was a gun.
It's now been confirmed that it was an actual gun, not a nail gun, so we've got police responding as well as critical care paramedics and a crew.
Roger, thank you.
Dan is closest to the scene. He is 7 minutes from the incident. A critical care paramedic is dispatched and is 9 minutes away. Ambulance 5289 will be on scene in 15 minutes. Multiple police units are also assigned to the job.
The moment you hear shooting, it catches you by surprise. It's certainly something you don't see a lot of, so there's a little bit of scare there. But you back yourself, you back your colleagues. We just staged here the critical care paramedic as well. Police have just gone past us, lights and sirens, so they're going to secure that scene to ensure that there's no damage or danger to us, and then we'll proceed in as a team. We want to make sure that that scene is completely clear of any potential dangers to us because no one wants to rescue the rescuer.
Goes to 507084, 505302. Safe to go in as per GPS.
050704, thanking you. 302084, moving into scene. The unknown is something that we deal with in every single situation we go to. That keeps you on your toes.
Hey, what's happened tonight, buddy?
I just dropped it and it went off.
Pop that on your finger, mate.
But just one time?
Lucky, eh?
Regardless of what's gone on, we'll treat clinically and we'll treat that patient to the best of our ability.
Have you got any difficulty breathing at the moment?
No. Did it go through?
What's that?
Did it go through?
It's gone through.
Oh, so it's not in it.
He's got a single gunshot wound, but it's just it's through his shoulder and out.
You've got no other injuries anywhere else, buddy?
No.
No pain in your legs?
No.
Nothing in your groin?
No.
He was incredibly lucky. Whether it did drop while he was cleaning it or whether there was something else that went on, we'll never quite know.
Give him the head.
Going to get you outside to the car.
An inch or two difference. It can be a centimetre difference, a millimetre difference. It's an absolute lottery. Well, you get him a little bag if you've got his wallet or anything. Yep, he's got the phone. All right, we're going to take him up to the PA hospital, OK?
PA.
All right.
No.
Love you, my mate.
Okay, love you. All right, give us a ring, eh? You got your phone? Yeah.
You guys happy for that to close up?
Yes, please.
Thanks, guys. Can't pinpoint exactly what it is at night, but they can get weird and wonderful. Sierra 084, no units will be left on scene.
It's nearly midnight in the operations centre. 287 call-outs have already been dispatched and the calls continue to stream in.
Here we go. Ambulance, what is the town or suburb of the emergency?
House is on fire.
Okay, is anyone inside?
There's nobody inside.
Okay.
I've got 3 young people injured at the moment.
Okay. We need some help for them, okay?
I have blood everywhere.
And what caused you to fall over?
I was drinking.
There was 20 plus people in a fight, and one male was knocked unconscious.
We've got only one car there and a plethora of pending cases.
453, I'm just about to clear you.
Roger.
Ready for their next job are veteran paramedic Shane and rookie Shelley.
But I mean, I haven't even done an asthma that sick yet. No.
Shelley is a new gen paramedic with a university degree, while Shane's 15 years experience has been on the job.
You can always get the big RTC on a Friday, Saturday night too.
Yep.
A lot of the big jobs I go to, it's still the first time I've gone to it. Can I handle it? Yes. But has Shane seen it 100 times? Also, yes.
I haven't seen the moon tonight, have you?
How do you know where it's at, though?
I'll look up in the sky. Like most other people.
Ambulance, what's a town or suburb of the emergency?
There's been an accident. A car's run into, I don't even know what, a van on the side of the road.
How many people are hurt?
There's just one driver in the car by the looks of it. He's stuck in there.
Ooh, here you go. 1B, male conscious breathing, car versus parked car. He is stuck in the car with a head injury, blood gushing from head.
In ambulance 5453, Shane and Shelley are 14 minutes from the crash. Senior Operations Supervisor Dan has also been dispatched and is 8 minutes away. Additional police and fire units are en route.
It looks like there's multiple calls coming in for this one, which usually means it's something that looks pretty big because a lot of people will drive past and see it and want to call it in. Police are there now, male believed to be trapped in vehicle, unknown if he's conscious or not, nil further at this stage.
Entrapments are very hard to access and they can go downhill pretty quickly. Clear left. You've been to a ton of these, Shana. Any advice for an entrapment?
Do your basics, get appropriate OV access and pain relief on board, and be ready for it to go south.
Yeah.
It's always good to work with someone who's enthusiastic as Shelley. She's got really good book smarts, and I've got the experience. So we work really well together in that way.
I wonder if he's been drink driving or just lost control of his car. Pretty unlucky to hit a parked car.
Well, they do jump out in front of you.
The parked ones, yeah.
04, male patient, exit 14, intoxicated.
Oh, as suspected. It's a residential street. Run into a car.
Taking the back streets home?
Yeah, busted custard.
Before I started as a paramedic, I had a really low threshold for drink driving. A few boys I knew growing up in high school were in an accident. They were both drinking at the time and they died. And ever since then, you just think, why do people do it?
Oh, there you go. Dan's on speakerphone. All right, boys and girls, it's game time.
In southeast Brisbane, Senior Operations Supervisor Dan is first on scene to a young male driver who has hit a parked car at speed.
Over the years that I've been in this job, I've seen multiple lives lost because of drink drivers. Hey guys, what's going on?
We crashed the vehicle.
Yep.
You can smell a bit of liquor on his breath.
Okay. Whether it's a child, whether it's a grandmother, whether it's a member of the prison system, at the end of the day, it doesn't matter who you are that we go to in the community, you receive the same level of care from our paramedics. Hello, I'm Dan from the ambulance. I'm going to get straight to the point. You've got a lot of blood around your head. Yep. Okay, so you've crashed your car, possibly had a bit to drink tonight. Now, have you knocked yourself out at all? Do you remember everything that occurred? Let's grab one of your hands.
I remember most of it.
Remember most of it?
I wouldn't remember, crashing.
Okay. Yep. You know, head injuries, people can be acting quite normally and there might be a slow progressive bleed on the brain. Should try and stay nice and still. Don't move your head for me, okay? Try and stay nice and still because it looks like a big impact that you've had here, okay? Yeah. So you want to stay nice and still. Yeah. Because you don't know what's going on, and because you've got a bit of alcohol in your system as well, we need to take you up to hospital. It's unpredictable. You don't know what's going to happen. Well, apparently we've come into the back of this car here, okay? But as you can see from your front windscreen, you've done a heck of a lot of damage there. Keep that head still for me. Hey, how are you? You did crash. This is Shelley, okay? So he's a little bit drowsy. Basically, he's blown about 0.073 or so. DCS 14, doesn't know what he's done, doesn't know where he's been.
That's all right, I'll tell you what. We're going to get you on our bed. What we really want you to do is keep your head still. I know Dan told you that, though.
You guys are nice and slow.
Nice and slow. Nice and slow. That's it. Go spin around. There we are. Pop your bottom up. All right. Because he can't quite remember the event, we're going to take all the precautions we can. They're just going to do a few other little things. So they're just doing a full assessment on him at the moment.
You'll go to a car crash and people can look really well when really there's something else going on underneath.
Do you have a headache? Oh.
Not really.
Do you have pain anywhere?
No, I don't.
No?
Just because someone comes out walking and is talking to you doesn't mean they're not sick.
What happened with you?
You've been in a car crash.
Car crash?
Yeah.
I'm going to guess that you didn't have the seatbelt on, to be honest, because...
He's got no seatbelt marks. Probably hit the windscreen then, hey?
Yeah, I'm pretty sure he has, to be honest.
Yeah. Were you wearing a seatbelt?
I was actually walking,
All right, it's going to be a sting in your arm. I need you to stay nice and still,
and then
okay?
you were walking to a mate's place. You were seen in the car, buddy.
Oh, was it?
Yeah. You've been in a car accident.
The hard thing when they've been drinking is intoxication and head injuries present very similarly clinically. So it's about, acting smart and acting fast.
So you crashed my car?
You did.
Hey.
So our concern is you've been in a car crash and you're quite confused because it could be a little bit to do with the booze, but worst case scenario, you have a head injury, okay? So that's why we want you to stay really still. We're going to keep rousing on you, but we're going to take you up to hospital, they're going to fuss over you and they're going to do scans, okay? Happy days, we're good. Sorry?
What happened with the giant hit or something?
I suspect that you have driven your car and I think you've just clipped the back of a truck. Parked car. Just leave your head, leave your head. Leave it, don't pull it off. Well, now it's in your eyes. No, let me touch it. All right, hands off, don't touch your head. New house rule, don't touch your head. All right, you good? Okay. Do you remember us getting to you? Yeah?
Yeah.
Do you remember what happened yet?
Got up limits and crashed the car.
You can't really remember, hey?
Yeah, I can't
That's all right. Like I said, it's more important that you're okay.
Oh, absolutely.
Yeah. No, 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 no. Just stay really still, okay? Well, they're gonna love you in here, hey, Shane? Well, I hope you get discount at work because I cut your clothes off. You're a lucky boy.
It's 2 a.m. and Shane and Shelley have still got 5 hours to go on their shift.
More lamb chops? Put that in the vent, please. I want to smell that the rest of shift.
Lamb chops and a risotto.
Of all the delicious things you've ever brought to work, Shane, that takes the bait. That smells so good. It's the highlight of my stint with you has been smelling your lamb chops. Oh, not even joking.
Friday night special.
Oh, so good.
Ambulance, tell me exactly what happened.
My partner obviously can't handle alcohol very well, which I had no idea of. I've had more alcohol than he is, but he's been vomiting for about 20 minutes. I've tried to get a piece of plain toast into him, but he just won't stop vomiting and he can barely even see straight. I'm really worried.
Is he completely alert?
No, he's almost like narcoleptic.
Is he breathing normally?
Not really, it's quite slow, heavy.
Is he bleeding or vomiting blood?
There was a little bit. I'm really worried about him.
Alrighty, so the paramedics are organised.
Alrighty, awesome. Thank you so much.
We're going to a 20-year-old male who's been drinking and he's been vomiting for 20 minutes and won't stop. Obviously, if he's that intoxicated that he can't manage his own airway...
There's a bit of a risk to himself.
Yeah, concerns he could vomit and aspirate.
Yeah.
It's just going to be a whole new world of hurt for him.
What did you say? It is what it is. We're dealt the hand that we're dealt. It's just another day in the life of a QAS paramedic and a page in the book. I like working with Shano, probably one of my favourite people to work with. He brings a life experience. He's a good mentor. It's fun to learn from, but it's also fun to be that young one who just keeps him on his toes, just annoys him all day.
Shane, it's your little girl's 18th tonight, isn't it?
It is.
Do you think there might be some 20-year-old drunk boys vomiting at her party?
If that's all they're doing at her party, that's okay. No, she's a good girl. She'll be fine. In Australia, we seem to have this culture of young people with parties and binge drinking, trying to get as drunk as you possibly can until you pass out. I really think alcohol is the biggest problem out there.
Yeah.
It's a legalised drug, so I'm not really sure what the solution is, but we do need to look at it as a community, as a society, on how we can probably address that a little bit better. How you going, guys? How you going, mate? All right, where are we going? Inside, is he? Oh, is there a party here tonight? The 21st.
Is that vomit? No, we don't want that. We'll get a clean bag.
I don't think anyone wants that.
Here you go. Happy birthday.
Is that amazing?
Put him on that tree.
All righty. I might ask some of you guys all to hop outside if you don't mind.
All right, your job is hold. No. Hold the yellow bit.
Can we get you guys to all hop outside? Tell me what's happened tonight.
A mix, maybe rum and coke, plain coke.
Yeah.
That sort of stuff.
No worries. Has he ever been like this before?
Not that I'm aware of.
Yeah. Does he live here or is he lives here? Is this Mum?
Yeah, that's Mum, yeah.
I'll just go and have a chat to Mum. Hey, Mum. Any other medical history, Dale?
He's on the tablets. He did tell me earlier on tonight that he's found out some bad news about his father.
Alrighty.
I'm not his natural mother. I just took him in when he was the age of 14.
When I see these cases, I think of my kids. We quite often deal with vulnerable young people in our job. It can be tough hearing some of these stories people have, some of the hard upbringings they've had. It can be quite heartbreaking as well. And that's why it's also important never to judge a book by its cover.
How many drinks did you reckon? Over 20 drinks.
Because he's vomiting, he's unable to walk properly. Our concerns are if he's laying on his bed, if he's asleep, he vomits, he could aspirate on his vomit and get sick. So he needs to go to a place where he can just be watched for a couple of hours and be looked after. Now, you two seem relatively sober. I've got a little job for you. Yep. It's to get him out to our ambulance safely for me. You need to walk for them. Sit down there. Good work. I hope this isn't happening at my daughter's party.
I think worse is going to be happening. She's her 18th.
All righty, mate. Let's get you to the safe place, eh?
If you don't have empathy or sympathy for some of these people, you're not going to last very long in this job. Quite often, some of us will save up our empathy for those that we believe that deserve it.
Hello. Can you hold your head up straight for me? That's a bit better.
Those that do deserve it certainly will get it in bucket loads.
So how did you two meet? Out of interest. I was going to say, which website? And is this the one? Is this the one? Is this the big relationship?
To the hospital.
Sounds like true.
Telling someone you love for the first time while throwing up into a bag's romantic.
He told you he loves you. Oh, that's so sweet. Hey? This just sounds like true love. So is he going to be in trouble tomorrow with you?
I just want to make sure he's all right. He kept saying sorry and I wanted to smack him. I don't care that he's doing something silly. He drank less than I did. It's not his fault.
I actually suspect he might have had a little bit more than you tonight, yeah. Hold your hand up. Is it my job to look after everybody out there? Of course it's my job to look after everybody that's out there. Is it a job that I want to do? Absolutely. That's why I keep telling everybody I think I've got the best job in the world, because it's just something that I want to do. Thanks for your help tonight. Appreciate it. Poor young fella. I think there's something wrong with the 20th drink that he had that made him unwell.
Probably.
The first 19 were okay, but
usually it's the 20th that gets you.
One that just was pretty much how we've done many, many times before.
And many more to come.
To come.
It's 6:15 a.m. and as the city of Brisbane wakes up, paramedics Shelley and Shane are nearing the end of their shift.
Being in the cab with your partner for 12 hours a day, you get to become very familiar with each other. You overshare a lot.
I feed my cats Weet-Bix.
Of course you do.
Yeah, they usually have steak for breakfast. Weet-Bix is just like a sometimes treat.
What sort of steak do you feed them?
Just cat steak.
Is there such a thing as cat steak?
Yeah. It's just cow steak, but they cut it up so it's like cat-sized pieces.
You are going to grow into be a crazy old cat lady.
Not even when I'm old. Goal is by 30.
All right, so I'm organising help for you now. Just stay on the line and I'll tell you exactly what to do next.
In the Brisbane Operations Centre, overnight call takers have answered more than 600 calls. 6:20 a.m. marks the changeover from night crew to day crew. The call takers start earlier than the on-road paramedics to assist with the handover of active jobs.
Any crews that logged on, I've been actually paging them, telling them at the same time about the CT scanner.
Yeah.
All right. Have a good day.
All right, you too.
See ya.
The people that have been out are now home and sleeping, and all the other people that would go out to the beach or to play sport or whatever, they haven't started that yet. Yeah, it'll be quiet for a few hours, I think.
I was playing soccer and I slipped over and hit the ground and I was dislocating my shoulder. How high is the tree?
Yeah, how high was he in the tree?
Oh, well, it's quite a big tree, double tree, you know.
I've got a boy who looks like he's hyperextended and broken his elbow or his upper, just above his elbow.
All right, I'm organising help for you now. Just stay on the line. I'll tell you exactly what to do next.
ambulance. What's the town or suburb of your emergency?
Hi, I'm calling from Altandy train station, Sunnybank.
Okay, tell me exactly what happened.
I've got a 67-year-old male who's got chest pain and he's got pain down his left arm.
All right, I've organised paramedics to help. Just stay on the line. I'll tell you exactly what to do next.
Alrighty. Shelley.
What do we got?
67-year-old male, chest pain at the train station.
At the train station?
Yeah. Is he completely alert?
Yes, he is.
And is he breathing normally?
Are you finding it hard to breathe for? Yes.
He saw us at the intersection.
Alrighty. Game face on.
All right, game face. Hang on, let me put a nicer siren on. There we go.
Oh, this could be it, Shane. Could be a big STEMI at a train station.
It could be. Let's hope for his sake it's not.
As a paramedic, you're always looking at what could be the worst case scenario that could happen, because we've been to those worst case scenarios.
That's our meeting party there.
Jump up on the grass?
Why not?
Why not?
I think because you see so many different things, you have a greater understanding of how life can just change in an instant, not only for the patient, but for the family. You just realise that life is pretty precious.
What's going on, Alan?
Pain here.
Are you feeling dizzy or lightheaded?
Oh, no, just the pains.
All right, how bad's that pain out of 10, buddy?
Oh, I'd say 9.
9? Did you get sweaty at all?
Yeah, a bit.
Yeah. All righty. Have you been well recently?
Yeah, I've been really good.
All righty.
I lost 1 kilo between last year and now.
Oh, well done. I found it. It's all here.
Yeah.
So what time did this pain start?
Probably about...
It's about an hour ago while you're walking up the hill, eh?
Yeah.
So you've got your inferior, definitely. You've got your ABL and lead one. I'll go get us a bed.
Good news is we know what's going on, mate. The bad news is it looks like you're having a heart attack at the moment.
At Altandy train station, Shane and Shelley are treating 68-year-old Alan, who was found collapsed with chest pains.
I'll go get us a bed.
Good news is we know what's going on, mate. The bad news is it looks like you're having a heart attack at the moment. OK.
Cardiovascular disease is the leading cause of death in Australia, claiming 1 life every 12 minutes.
Generally, they're very calm. I've never really seen anybody panic too much. They're quite shocked to what's happening, in denial that this is happening to me.
Father died of a heart attack at 60.
What I'm going to do is we're going to get critical care paramedic here, and he's going to give us a hand.
With Alan's condition deteriorating, highly trained critical care paramedic Sophie is dispatched to assist.
302, code 1. Basically, a heart attack is a blood clot in a small vessel in your heart, which obviously stops blood flow and in turn oxygen, and the heart becomes damaged.
Just want to do another ECG on you. Yep. Not much doubt about it, I'm afraid, mate.
Does every minute count in these situations? Absolutely. Every minute he's waiting, every minute he's got that clot in his heart, he's got muscle starting to die.
Alpha is from Nathan, so shouldn't be far.
Worst case scenario is that he arrests and dies.
That's okay.
Alrighty.
So just full of rubbish.
We've got a bit of a difficult extrication out of here, mate, so...
We're in the middle of a train station. We obviously can't go out across the rails. We need to go up a lift, across a rail, down another lift. They talk about the duck floating across the pond, nice and smooth, but underneath those duck feet are going 100 miles an hour. That's generally a paramedic. Nice and smooth on the outside, but inside we're going at 100 miles an hour trying to ensure that we do everything that we can to save this patient.
Sounds like our help.
I'd just like to make a PCI referral for a 67-year-old male.
Sophie calls ahead to the hospital so Alan can be delivered directly to cardiology for surgery.
Got a strong family history. He's normotensive, but he is bradycardic at 50 with an inferior pattern.
With his condition so fragile, Sophie will travel with Alan as he may go into cardiac arrest.
You live at home alone, mate, or with your wife?
Wife and 2 sons.
Oh, sorry, Alan.
That's all right. It's my Falvina, it's the genes.
Yeah, your father, was it?
Yeah.
Sorry to hear that. Did he pass away?
Yeah, he had one. He's in hospital. Came to home a couple of weeks. Another one.
Sorry to hear that.
Looking at you and praying that things are going to be okay. You can see that in their face. All we can do is give them reassurance.
We made it, buddy. All good, eh?
Done really well, Alan.
All right. Everyone happy?
Yeah.
Saving a life, getting someone to somewhere where they can get their life saved, it gives you a sense of accomplishment.
And how's your pain, Alan?
It's a special privilege. You can say I played a small part in that.
All right, let's go. Home, James. Home.
Rainbow! This doesn't sum up our time together.
Roger 601451, good morning to you. Test stages coming through.
451, thanks for that.
In Brisbane's south, paramedic Peter and Phil are signing on for the day.
Put the seat down, mate, so if you need to pump it up...
No, not at all. I put it further down.
All right, really?
Having recently transferred to the Nathan station, this is Pete's first shift working with Phil, who immigrated from Hong Kong 10 years ago.
I have coffee, then tea, and then booze.
Booze?
Yeah, no.
Little nips of a scotch or...
Not that one.
Not that one?
Yeah.
So what did you do back home?
Me?
Yeah.
Oh, I'm a boring boy. I did very similar.
Yeah.
So I was an ED doctor.
Yeah, wow, that's awesome.
And we don't have paramedics.
At all?
Doctor and nurse are in the ambulance.
Okay.
It was quite good, but the workload, how many patients we got in total for a day? The highest?
I think the highest I've done is probably 7, 8 in a 12-hour shift.
Similar as me, but back to China.
Yeah.
50 is the least.
What? 50?
Yeah. Can up to 85.
Really?
Yeah.
That's nuts.
Ambulance, what's the town or suburb of the emergency?
My wife's beside me. She just got clipped with a chainsaw.
Can you see or feel any part of the baby?
She's got her handcuffed.
Oh my God! And my son, I think he's having an allergic reaction to something.
So has he ever had a severe allergic reaction before?
No.
Never.
It's my buddy, his javelin, and it's penetrated into his groin. Okay. So he's in a lot of pain.
An urgent call has come in from a sports field south of Brisbane CBD.
Now, is there any serious bleeding? Yes, he's bleeding a lot.
Has it gone into his penis or his testicles at all? You need to look at it for me.
Can you just roll over for me, buddy? I think it's in the wedge of the groin. Jerome, is it in your genitals?
Patient's a 20-year-old male, punctured and breathing. He has trauma, javelin to the groin. Code 1, all units, thanks.
It's a long spear.
Yeah. You throw.
Flow into the groin and close to the testicle.
Peter and Phil are the closest ambulance and will be on scene in 5 minutes. A critical care paramedic is also dispatched.
Is it a large wound?
I think it might be quite deep.
There are definitely times where you look at and the details coming through and you just don't believe what you're going to. You just think, how can this be real?
Yeah, how's that bleeding going? Keep a steady pressure on it.
You don't know what to expect heading in there, so you think, what am I going to do? I've got no idea how this person's going to be.
There's multiple ambulances on the way. They're cutting lights and sirens.
Here he is.
Yeah, he is.
Now, the ambulance has said that they can see you where they are. Can you see them?
Yeah, they're right here.
They're right there. All right, Liam, I'll leave you with the paramedics.
Yes.
The initial minutes of cases like this are just definitely something that you can't train for.
In Nathan's, south of Brisbane CBD, Phil and Peter are responding to a Code 1 emergency for an accident involving a javelin at a sports stadium.
Here he is.
Yeah, he is.
Going through your head, you just think, I don't know what to expect. The initial minutes of cases like this are just definitely something that you can't train for.
Hi, I'm Phil. What happened?
There was a javelin on the ground and he ran into the javelin.
Oh, he ran into it, locked the javelin, just flopped. Okay. Yeah, Jerome. Can we have a look?
Yeah, sure.
Yes. So it's very painful? Yeah. Yeah, can you it's still bleeding or not?
I'm not sure.
Can you let go and we have a look?
If the javelin has hit an artery, the patient may be bleeding internally.
And I need to put this off, okay?
Mate, I'm just going to do your blood pressure, okay?
Yeah, looks like it's the skin's open,
Okay.
but looks like inside is okay. The mark shows still there.
Jerome is lucky. The javelin hasn't penetrated too deeply and his genitals are intact.
How bad the pain is at the moment? 7. Okay, this one is into your mouth.
I'll try.
It doesn't taste good, but it's good for the pain. You can hold it yourself. It's just a whistle.
451 injury is to his right side groin. He is GCS 15, well perfused, good radial pulse. That's the way, keep breathing on that. Doing really good, Jerome.
We're gonna move you, okay?
Keep you nice and covered up, Jerome, okay?
Yeah, 1, 2, 3. That's it. Which country are you from?
Hong Kong.
Hong Kong.
Yeah, what about you?
廣東話、粵語。
講識講啦。
係啊。
Oh my god.
Before working with Phil, I didn't know a lot about him. So to find that he's worked as a doctor in ED departments within China, that's rare.
Cantonese.
Perfect.
This is my language. So how about a pain out of 10?
I think it's like 6.5 right now.
So everything's good so far, except the pain. Okay.
Don't mention it, it's fine. One more second.
I'm giving you morphine for the pain, okay?
Just gonna move off Phil, okay?
Yeah, all good. Okay, can you tell us again what happened?
So, there's a javelin on the floor.
On the floor, yeah.
And I ran into it.
You ran into it?
Well, I ran into it.
You ran into it. How about the pain?
I don't know anymore. Thanks a lot for it.
No worries.
Next time you come to Hong Kong, you should visit me. Seriously.
Yeah, why not?
Seriously. I like making friends.
Yeah, making friends is good.
Where's your mates?
Peter.
Yeah.
Hi, Peter. Hello. Thank you for driving. It was very good.
No
and
worries.
thank you for your help as well.
Thank you, guys.
Hopefully it was comfortable, Jerome.
Yeah, it's really comfortable.
All right.
Can I have my phone real quick? I just want to text my mom.
Why not?
Tell her.
Okay. Let them know.
Can I take a quick picture?
Why not?
If you don't mind.
Me?
Would you like to be in the picture?
Yeah, why not?
All right, thank you.
Or you can do the selfie.
Yeah, sure.
Hi.
I'm gonna be fine. I'll survive.
Jerome, it's not every day you get to go to someone who's had a javelin stuck in a sensitive
Yeah,
place.
it's so unusual, right?
Yeah.